like to think that usually the biggest discussions and the important topics are not discussed in the open, in the large stage. That's a place where people pat their backs at what have been achieved. But the real changes start in rooms like this. And I hope that we'll be repeating this today and we move then to brain-computer interface for good. And as I said, we will start with what is the state of the field and the definitions of what these technologies are. And let me welcome my co-organizer, Sumner Norman, who will give us first introduction to the topic, and then we'll be joined by a first set of panelists to address these issues. Thank you, Sumner.
All right, there is a pretty incredible group of people in this room, so I will try to keep these remarks as brief as I can, with the goal that we all share a very common lexicon on what we're talking about, what we mean by a brain-machine interface, what are the various techniques available to us today, how do they relate to all of these questions. You'll have to bear with us. We have had some IT hiccups today, but we're going to do our very best with it. So give me just a moment to connect. So far, so good. If this gets hiccupy, you guys point me out so I don't have to keep staring backward. All right, so first of all, very basic definition. What is a brain-computer interface? What are we actually talking about? These can seem very complicated and there's lots and lots of math and cool things going on, but actually they're very, very simple at their core. You have to measure some type of biophysical signal. That might be the electricity of neurons, might be the magnetic dipoles they create, might be the blood flow that perfuses those neurons as they're active and use metabolic resources. And those are various techniques to measure those, from EEG to ECOG. I'm going to go into those and others, but you're getting signals out of the brain or the central nervous system somehow. That's going to go out to a computer, typically, that does some type of decoding or interpretation. So you'll hear us talk about decoders all the time. What are we actually interpreting from the brain? What was the person actually intending to do? And can just from the brain activity alone, we learn something? Once you do that, and I've kind of put AI, ML there, most of what we do is ML. I'm going to come back to like what we actually mean when we're talking about AI, but you'll see this pop up throughout the talk. Once you've made the interpretation, the external commands are really anyone's guess. It could be a robotic arm, it could be a cursor on a screen, it could be an airplane. Those are all mostly motor neuroprosthetics. And in those cases, you'll see this kind of feedback loop going back is usually just going to be vision. But now we're starting to see intracortical microstimulation and other ways where you actually directly stimulate the nervous system as a form of feedback. So you'll see those come up as well. And I'll also specifically call out and include the types of systems where you're actually measuring brain states and then directly influencing the brain state without the person necessarily having some active willing participation. So this might include for mental health disorders and neuropsychiatric disorders, sensing the brain state and then stimulating the brain in closed loop. So it's the closed loopedness, I think, that makes this special. I'm going to give you a very brief history of BCI. I like doing this because it explains where a lot of the field came from, going all the way back to the 1780s, couple snapshots. So Luigi Galvani stimulates the frog legs and says, okay, electricity has something to do with the nervous system because these frog legs are twitching when I put a voltage through them. But jumping forward a couple hundred years, Hans Berger now starting to measure electroencephalographic signals. So now we're starting to see brain waves in human beings, and tells us a little bit about what's going on, in that case, non-invasively. 1963, Jose Delgado has this kind of amazing open loop demonstration. So I don't know if I've actually called this a BCI yet, but if you look closely in his left hand, he has this transceiver that's wirelessly connected to an implant in the bull's head. And so when it's running at him, he presses that and it actually arrests the bull's movement. So kind of a striking demonstration. And he's not a matador, to be clear, he's a narcoleptic. Okay, now we're actually getting to closed loop BCI. And I'm going to talk a little bit about intracortical first, and then I'm going to move my way out of the brain. But starting with intracortical, because that's where the history starts. 1969, Ed Fetz, I think at the time he was a postdoc at the University of Washington, taught a non-human primate, a monkey, to control the firing rate of an individual neuron. And if he controlled the firing rate correctly, he would get a sip of juice, the monkey, not Ed Fetz. And that taught us a couple of things. One, operant conditioning works. You can actually, just through feedback alone, teach a person to change something about their behavior and therefore their neural activity, in this case, a monkey. And also the closed loop BCI is a thing. I do want to point out here, the AI here is not AI. It's not even really ML. It's just a very simple logic gate. If the firing rate's greater than the threshold, give the juice. You'll see this advance as we go. So jumping forward into the 90s, groups like Andy Schwartz's, Miguel Nicolelis, sorry, the movie didn't start, Richard Anderson and others start to put ensembles of activities. So now multiple neurons. Some neurons are tuned or fire when the monkey intends to move to the right, some left, up, down. And eventually you can put those together into a very simple model and recreate the intended direction that that monkey wanted to create. Here, he's been trained to reach out this robotic arm, this black bar. If he does that correctly, he gets a sip of juice. Does anyone recognize the equation here for the ML portion? Yeah, I'm seeing nodding heads from the BCI people. This is basic linear regression. This is machine learning like 101. This is the vast majority of BCIs. So we talk a lot about AI today, but I want to point out that a lot of the motor neuroprosthetics are still built on this basic framework of very simple linear regressions. Jumping forward, we now see this in humans. This is actually my co-founder, Tyson, who previously was the executive director of the Chen Brain Machine Interface Center at Caltech, where we worked together. And this is his first patient, Eric Sorto, in 2015, who had a gunshot wound to the neck about 15 years. And when we asked him what he wanted to do, he's like, "Man, I just want to have a beer. And I want to caretake for my mom, not really talking about it." And yeah, this is kind of the magic of intercourse. Of course, we're seeing lots and lots of commercialization efforts these days. I like to point this out because everyone kind of lost their minds about the Pong thing with Neuralink. So like BrainGate had people playing Pong in 2006. What's special here is what you don't see. No wires, no big research team behind the device necessarily, although in this case there was. But the idea being that this is a very big and very expensive commercialization effort that has brought a lot of attention and funding to the space. Other groups are doing very good work like Paradromics and BlackRock and intracortical commercial BCIs. Deep brain simulators have been around a long time, several decades, and are the most successful form of hard neurotech out there. A couple 100,000 of them implanted. And even perhaps more magical in some ways than motor neuroprosthetics, because if this thing, you turn it on and you see this person with a tremor assisted Parkinson's disease effectively stops. And that's kind of just magical. Gonna keep moving. Now I'm moving out of the brain a little bit. And so no longer actually inside the brain, in the brain parenchyma, which is quite invasive, but instead now you are actually sitting on top of the brain. This is electrocorticography or ECOG. I hope this video works. I don't know if it's going to be honest, with the visual.
The proof that you are seeking is not available in books.
All right, that's not a great demo, but the point is that in this example, the person is actually attempting to speak, but I think in this one they actually had the ability. Later on, they showed this in a person with anarthria. So the inability to speak is a neurological condition. But by measuring the motor activity from speech motor cortical areas, the larynx, the tongue, and so on, they can reconstruct that speech and put it into a MEL spectrogram and play it back to you, and it sounds like natural speech. So speech areas, I think we have a couple experts in the audience today, so I'm sure you'll hear more about this, are incredibly exciting for BCIs. A commercial example, Precision Neurotech has raised an incredible amount of money to build this into a commercial device, and some other upcoming groups are doing the same. Quickly plugging my work. So my company, I'm the CEO and co-founder of Forest Neurotech, where we're developing an implantable ultrasound-based BCI. So this is even a little less invasive than ECOG. Most ECOG sits underneath the dura mater on top of the brain. We're sitting outside of the dura mater. This is an epidural device that sits inside the skull, and we use ultrasound to beam down into the brain to enable whole brain functional imaging. So think fMRI, but much higher resolution and sensitivity. And also focused ultrasound neuromodulation, so then actually focusing those beams to change neuromodulation in the brain. We just launched this past October as a nonprofit focused research organization. So if you're familiar with the NeuroPixels effort, a little like that, we create the devices, we try to get them in the hands of researchers and clinicians across a broad range of neurological dysfunction. Now going out further, outside of the head entirely, so now wearable BCIs. I'm just going to touch on one modality, the most common, which is EEG. You could also talk about MEG, EEG, electroencephalography, MEG is magnetoencephalography as in magnetics, and FNIR is functional near-infrared spectroscopy, so using light. And so you're starting to see all these different physics-based mechanisms. In the case of EEG, you can see the person here actually controlling this 2D cursor. So this isn't going to have the fluidity and speed as something that's actually implanted deep down into the brain, but of course, this doesn't require surgery. So far, I've talked a lot about replacement, but you can also restore function. So this is going back to that point about operant conditioning with Ed Fetz's monkey. So if, and this is in the case of neuro rehab, start the video, you can actually train a person to create brain states that are actually more conducive to their recovery after a neurological injury like stroke. And so in these cases, there's kind of, again, the magic is not so much in the restoration, which at EEG is more difficult to get out of, but in training the person to go home, take the device off, and have better functioning use of their own limbs. I'm going to quickly touch on the intersection between AI or ML and BCI and give you a little sense of the state of the art. This is a paper from 2017 from Chetan Kadaranath's group, where they were inferring single trial activity from implanted monkeys based on population dynamics. So now they're measuring the brain of the monkey over a long period of time, building an understanding using deep neural networks, and I think convolutional neural networks in this case, to build a latent space of activity and understand the dynamics of that neural activity. And once they do that, they can actually, you see these trajectories on the right, much cleaned up from those priors that are built into the data set. Another example, MindEye 2. So this just came out recently on Archive. So here, and there's many examples of this going all the way back to like Nishimoto 2011 and Jack Gallant's lab. So this is not a new concept necessarily, but the latest version is pretty striking, where you can actually show a participant data. So they're watching a video stream, record their brain activity using functional MRI, and then reconstruct the image that they were seeing. The difficulty here is that you need a huge training data set for each individual person. And what this paper shows us is that if you record from 8 people and build a data set of 40 hours per person, that's a lot of time in the scanner, then you can bring in the 9th person, stick them in the scanner, and with only an hour of training, it can actually perform about just as well. And I think this is starting to bridge on what you might call AI, because that's the foundations of what people would call a foundational model for the brain. So we're all familiar with ChatGPT. This is a large language model. Of course, it was trained on a massive corpus of data, and that allows you to accelerate workflows, predict the next token or word, and then therefore that allows you to generalize across use cases. This is same sorts of ideas, accelerating neuroscience, predicting the next what's happening in silico, and then generalize across people, in this case, like the MindEye paper, and eventually across use cases. So this is where the field is starting to head, but I wouldn't say that we're there yet. There are 3 elements that make AI. So this is the kind of Andrej Karpathy school on Twitter, but this is like just well understood in the space that what makes the current GPTs, LLMs so special is not only their architecture. Transformers have been around since 2017, but it's the 3 key elements of the data set: quality, diversity, and quantity of data. We really struggle with this in neuroscience. Collecting a lot of data is very expensive and slow, and we need people in the room. The quality of that data is really difficult to get as well, because these are noisy signals quite often. Biology is very squishy. And finally, you want a diversity of data. So most of this data is collected in experimental rooms or scanners. We'd like to get that out into the open and natural environments. And once you have those 3 ingredients, then I think we can talk about real AI for neurotech. I'm going to skip past this just to save time. But I think in the future, as we start to treat many conditions, moving from paralysis and into many neuropsychiatric and cognitive disorders, then we can talk about how that moves into not only replacing function, but even for health. So with that, I will stop. I will welcome our panelists, Daniel Rubin, Anna Marquez, and Kieran.
I invite panelists to come to the stage and each of them to briefly introduce you and looking forward to the exchange.
Hi, everyone. Good morning. I know we're in the basement, but as you said, this is a room where it happens. We should all be singing Hamilton at some point. But In any case, I'm Anna Maikes. I'm the CEO and founder of Neuroelectrics, also known as the lady in the cap worldwide. Without the cap, I'm hardly recognized. So now this is me. And my company, Neuroelectrics, is developing what I believe is the new generation of neurocircuit therapeutics. So this is a non-invasive EEG, as Summer has mentioned, but it's also a brain stimulator. So any of the electrodes that I'm wearing can inject low currents into the brain. And we believe this has the potential to help many patients. So we are in an FDA pivotal trial in epilepsy, almost 200 patients in 40 hospitals. We aim to become the first company in the world to go through the US FDA regulation for epilepsy. And we're also working on depression. So the future should be that we can prescribe this device home use to patients. And every time you send them home, you record their EEG, it gets into our computational neuroscience model called neurotwin of the brain, a very sophisticated piece of technology. And then we personalize a treatment for you, for your brain on the fly. So I think this is how we see the future, and the FDA agrees. So, we are super happy, still a lot of work to do, but holding there, and I hope one day you don't suffer diseases, but if you do, I'll send you our cap.
Hi everyone, my name is Dan Rubin. I'm a neurologist at Mass General Hospital, one of the principal investigators on the BrainGate clinical trial. BrainGate is the largest, longest running clinical trial for an intracortical brain-computer interface. So as someone described, we work with participants who have paralysis. We place a series of microliquid arrays, typically over the precentral gyrus, the motor cortex, and record the intended activity, the neural activity as our participants intend different movements, either movements of the hand, wrist, and arm, or more recently intended movements of the muscles of articulation as they attempt to speak. And we use those signals and decode them in real time to restore and maintain neurologic function. The goal of this work is to be able to tell all people with paralysis, be it from spinal cord injury, ALS, brainstem stroke, muscular dystrophy, potentially many other conditions, that no matter what their symptoms are, or in the case of progressive conditions like ALS, no matter how severe the symptoms get, they'll never lose the ability to communicate. And for those patients who have lost function due to an acute injury like a spinal cord injury or stroke, they'll be able to restore function immediately. And that's our long-term goal. As we've been running for a while, and we've made a lot of progress over time, much of it due in large part to the advances in AI that have occurred in parallel with our efforts. Excited to share some of what we do and my thoughts on where we go from here.
Thanks for that, Daniel. And last but not least, Gernot.
Yeah, hello everyone. My name is Gernot Müller-Kutz. I'm from Graz University of Technology, and I'm leading the Graz BCI lab. We do BCI since 1991, and our aim is to provide new methods to the researchers. We do this for many, many years in the non-invasive way. Our goal is, my goal is to establish brain-computer interfaces for motor restoration in spinal cord injured people. So we do many, many projects on the way so far. Seeing or squeezing out the maximum of the noisy EEG data. So what is possible? We are at the stage of single movement attempt detection and classification, or continuous control in the 2D plane with that noisy signal, but not losing the contact to the patient's group, who are our goal to help them. So this is very important for us to not study things which are not important for the people anymore. We are also always trying to help people who lost communication, the original goal of brain-computer interfaces. So there are several ideas out there used for many, many years, like the P300 wave is used in ALS patients, for example, by many research groups, also with people at home. In the last years, we were working together with some other partners in Europe, with Professor Ramsey in Utrecht and the WIS Center here in Geneva, and also Cortec in Freiburg, to establish an implanted device for ALS patients, which is completely covered. So a complete wireless system, which patients can wear at home to establish communication in a way. I think always the cap in this way for these people who have a lot of burden already is a way to go. So that's everything I started today.
Thanks a lot, Gernot. And as I said, the goal of this first part of today's session is to understand a little bit more about what's behind these technologies. We had a first introduction. I want to dig a little bit deeper on the current state of brain-computer interfaces, how they are developed today, and how the field has changed. And I'd like us to start by that. So, because despite your striking young age, you have been in the field for quite a bit of time. So what would be, in your opinion, the changes in the field of BCIs and development of different types of BCIs in the last 15, 20 years? Or are we still at the same stage where we were when you started? I hope not.
I have a short answer for this, or an interesting answer, maybe. At least I find that quite nice. So when I was doing my PhD, starting in 2000, a colleague used neural networks to calculate a model that can be used as a BCI system. However, computers 24 years ago were not very fast, at least what we think that is not fast. And so the calculations took 2 years, 2 months to 1 month, something like this, to create that neural network. But already the participant went home already after the training classes. Yeah. So and remounting never led to the results we wanted to see. Somehow maybe we are at the same stage again. We have very powerful computers, very powerful neural networks, but again maybe they calculate 2 weeks at the moment to get things out. We need huge clusters to process the data, and we need to find a way to keep take the best of the good computers now and reduce the model size maybe on the other side, if we can use them. I don't know.
What has changed?
Well, I'm not so hard on myself because I think that, the people in the room and the field, we are working probably in the most sophisticated, most complex part of our body, right? And we need to acknowledge that we don't yet understand how the brain works. And so I'm not that hard, and I'm happy to be from Barcelona, where Ramon y Cajal is one of our few Nobel Prizes, right, on neuroscience. And I think that since I started in the field, we've gone so far, specifically because it's not only about the technology, it's about the funding to do things, right? We need to try this in patients. And, for Tim and Tanya and Summer and Jose and all the people that we've been in the field for ages, and Ramses and everyone, I mean, what has changed is that we've been here, 10 or 15 years, but now the world is watching and the money is coming, which I think is awesome. So, public acknowledgement to Elon Musk, I think is great to me, from my opinion, that he got in the field, he put the spotlight, and now we have these amazing companies, Synchron, Paradromics, Precision, all these companies doing amazing things with lots of money. So at the end, it's not only about the technology, but to bring it to patients, to have an impact, you also need funding. And I think I see that the public perception of neurotech, when we started, they look at us like we were weirdos. Now, like, we may, but people are starting to be like, it may work. And then the funding. So to me, and of course, AI, I mean, we've been using machine learning and all these tools forever. There's no way you can deal with the brain without these tools, but I think this is going to help us amazingly. So I am an optimistic. So I think it's a great moment for the field.
Sure. I want to start my answer on echoing on a sentiment that we still don't know how the brain works, right? It is the last frontier of human biology. I think it is. When I started in neuroscience and a lot of the early examples that Sumner showed in his presentation, particularly for motor BCIs, a lot of the early efforts in BCI were based on an approach where the developers, the neuroscientists, the engineers, tried to understand how the brain was actually encoding an action and use that understanding to build the BCI. So whether it be linear regression or looking for neurons that were tuned for one particular action or another. And a lot of the early BCI work was based on this assumption that individual brain cells or regions of the brain have tuning curves. And if you can just figure out what different parts of the brain are tuned to, then you can figure out the user's intended action. And that works and gets you pretty far. But with modern ML techniques and deep learning approaches with multi-layer RNNs, we've realized that you don't necessarily need to understand how the brain is doing a particular action to be able to decode it well. And the most successful and most powerful intracortical BCIs now are all based on sophisticated multi-layer RNNs. The hardware has improved to the point where, if you've got a beefy enough system in the participant's room, you can train a model in, say, 3 to 5 minutes if you sort of set your hyperparameters right from the get-go, and you can do your inference in real time. And now you've got these really powerful tools that can do the sort of decoding, like Sandra showed, like decoding someone's intended speech in real time, that could never be done with a tuning curve-based model. And what I think is most miraculous or magical about this is now we're reaching a point where we're turning around and saying, okay, we've sort of abandoned this prerequisite that we understand how each part of the brain does something in order to build a successful BCI. We're going to get the BCI working. We're going to restore function. And now we're turning around and saying, well, actually, we can learn from these. And a lot of the most recent successful efforts are looking at how neuronal activity actually compares to, say, large language models. And there's this whole effort looking at how different parts of the neural activity correlate with different layers of a multi-layer large language model. So, oh, well, maybe this is, how the brain structures language in such a hierarchy. And there's this whole brain score initiative that tries to compare neuronal activity to different large language models to see which is the one that most accurately reflects, endogenous neural activity. And sort of unsurprisingly, it's sort of your chat GPTs and the iterations of that seem to do best with these metrics. But we've reached a stage where we're turning things around, and instead of trying to build successful BCIs by understanding how the brain does something, we're building successful BCIs and then using them to understand how the brain does something. So we're learning neuroscience from our AI and from our machine learning tools. And I think that this is just going to continue to rapidly accelerate the pace of development for the good of the people that we're going to try and help.
Thank you very much. We heard very interesting points. On one hand, this increased attention on BCIs and neurotechnologies, the dependency that we have on the technical developments in other fields, and this potential virtuous cycle between the development of machine learning and AI methods and understanding of the brain, where this order or first understanding the brain to develop the coding methods is no longer necessary, but rather an interaction between these two approaches. But I want to get back to this point of the world is watching. And one of the things that we are familiar with is the famous Gardner hype curve. And from if we take the case of neural networks and many other technologies, the world have been watching technologies that have failed, probably because they peak too early, or as in the case of neural networks, they need to fail and go through a long winter before they could flourish. So what is the risk then of having these world's eyes focused on brain-computer interfaces to solve or to address some of these challenges in medical sector and other types of interaction, and the possibility of us as a community failing to deliver on that? And what would be your thoughts?
I'm not super worried because, bottom line, when I wake up every morning, and I'm not driven like by money or by it's really about the patients. So I hear patients approach my company every single day. So that kind of is a powerful driver. You all in the room have people with depression, or your mother is going to develop Alzheimer's, and current treatments don't work. Many drugs fail, so there is beautiful opportunity there. So no matter, I think that if there are players that act not correctly, the patients are in need of solutions out there. And I think in general, humanity has a lot of needs that neurotech can provide. So I think that, efforts like Karen is doing on the ethics, I think it's true that in all the workshops of neuroethics that I have participated, dealing with the brain is a new frontier that we've never exposed. So I think that it requires a deep discussion on, what our companies are doing with the brain, who owns, are we protecting human beings in terms of identity, agency, and autonomy? This is enchanted territory. It's not like having a social media account that you can disconnect. This is about what makes you human, which is your brain. So I agree that there is a level of concern that we all have to discuss. But on the bright side, come on, if you have a kid with a severe disease without a cure, or a father or a mother, that's going to stay there no matter what. So, we have to keep on working hard to make that happen and accessible to patients. So that's.
But maybe if I push back on that, because my role here is to be also provocative, is that the need may exist, but the type of solution may get their flow of money stopped. If we look at what happened, for instance, in the pharmaceutical sector, where at some point the pharmacological approaches to certain mental diseases were failing and failing and failing again, and made some of these companies to turn their attention to electrical stimulation or so-called electroceuticals. That meant that the money was diverted from one sector to the other. So aren't we potentially at risk of these BCIs not delivering?
You cannot think like that as an entrepreneur.
I'm the moderator. I'm not
You don't think like that. What you think is like, this is the vision, this is how I want it to be, this is the reality, and then you just go like hell, and if you have to and you have to change reality. The other day I was talking to the best reimbursement expert in the US, and I was saying, listen, you need to help me get this paid on a sustainable manner. And I said, but I know there are these constraints, and these in the US payment system say like, Anna, forget about it. What do you want? What do you want, Anna? And I said, well, I want my technology to be paid. I'm saying, don't worry, I'm the expert. We'll get it through. And I thought, oh, she's awesome. That's the attitude, Ricardo. It's not about the constraints. It's what we are going to create. Change that.
I would agree that one. I mean, I agree completely that at the end of the day, it's about the patients. And if we fail to live up to 90% of the hype, and we don't immediately deliver on all of the potential, particularly on a lot of the sort of augmentative function that people have talked about, if there are kids with cerebral palsy who communicate again, then that's a win, even if that's again only 5 or 10% of what we try to do, or for that matter, I mean, someone with paralysis who can control their own movements. The people who have neurologic injury, any amount of functional independence that you can restore is incredibly valuable for the quality of life. And I think that counts as a win, and I'm with you there. But I would agree that there are certain precautions that need to be taken. And I think the example you made of the pharmaceutical, but even within the BCI space, there are important examples. I think Second Sight is a good example of people who had a vision neuroprosthesis placed, and then the company lost funding, and eventually their devices lost support. And people who were relying on this technology to restore vision were told, at some point your device is going to stop working, and then there's going to be no company to help you, and you will, you couldn't see before, you could see with this device, and you won't be able to see again. So I think as we move forward with this technology, I think it's really critically important that any new technology that comes out there, particularly one that's meant to restore function, there needs to be a really solid long-term vision for how you're going to support people who, because this is all still research, so people are volunteering themselves to help develop this, right? They're not just doing it for themselves, they're doing it to help other people who have the condition they have in the future have technology that's going to help them live more independently. And so I think when researchers are writing grants, when companies are raising funds, part of what they need to do is build into their long-term plan, what are we going to do to support people through the lifetime of this technology and through their lifetimes? Because if there starts to be, rush of companies and research groups that create technology, restore function, and then the funding goes away, and then the people are left stranded, I think that's going to be something that could really set the field back a lot.
Yeah, so I see it a bit different to you, because I'm not an entrepreneur, I'm an academic. And the money for my people comes from research projects, and I need to get them first. And what I want to say, the louder it is, the more silent it is afterwards when you stop the loudness. So if the big efforts by this big, where the big money goes in at the moment, when they stop quickly, then it gets silenced for the whole field. And this is the danger I see, because an example is European Commission funded a lot of projects in the seventh framework, starting 2008, was it correct? Where we had a nice integrated project and several others afterwards. But this was only in this framework. So I saw many BCI groups in Europe coming and now disappearing, yeah, because there is no money anymore. And we don't have venture capital in Europe, where we get millions of millions to do something. We have one PhD student here, we have another PhD student there. And the fear is if there is a big fail, only the very strong groups can survive and continue their efforts because we want to help the people. And this is what I see a bit. And what I have the problem, I cannot evaluate what the big companies do since there are no publications. And I cannot see, I just rely on messages on a social platform. This is too less for me. And so this is, I'm a bit, yeah.
Yeah, that's good. That's good. I don't want my panelists to agree on everything. And I think there are several take-ups. I think one is that I guess the hype curve is in any case going to fall down by definition. Okay, I think the technology may not deliver in all the promises that are made, but one of the points that were made is that to identify what are these angles where the wins matter. And I think that's one important aspect for us to think, and also to imagine where the effort should be put, and where wins by this technology can create the greatest impact. I think another aspect, and especially for attendants who are not familiar with the funding mechanisms of the different sectors, when we have a research community that depends strongly on public funding from the research agencies, either national or regional, and the topics that get funded are chosen not only based on one particular need, but all the societal needs plus the socio-political context. So this can decide how much funding goes into one type of research or another type of research, and also the feeling of whether public money should go there, and whether the private funding sources will be sufficient to keep their developments alive. And that's basically a balance that depends not only on how strong the science or the technology is, but also other factors. And that these are basically what defines how the research and innovation live together and are able to finally get a salary at the end of their months. So I think we have mentioned these potential wins. So maybe just for to make them very specific, what do you think are the biggest wins that the BCIs can have in given the current state of technology? Where are these sectors or applications where we can make a change with what we have today technologically? And we can start with Gernot.
So the biggest win using BCI technology. I think we are about at the moment in this couple of years now where we really can help patients. So with these methods we developed, and we will still developing, but where we know where the path is going, I think we can really make the difference and finally bring it to the patients.
What kind of patients are you referring to?
I'm referring to severely disabled people. So like ALS in close to locked-in states, for example. Because it depends the type of BCI depends, in my opinion, on the type of patient we are using. Yeah. So we as able-bodied people, call it like this, would not go to an implant, most of us. Yeah. So we would appreciate a cap or something like this because we don't want to go for surgery. For patients who are really like bed bound or wheelchair bound and really have almost no communication anymore, maybe they would like to choose a system which enables them to communicate, but in a way which is not too much of an effort. When they have still eye movement, they will choose an eye tracking system. If this gets lost, maybe a BCI will be there. And I think we are there in this couple of years now, where we provide the technology that works for these kind of things.
Well, I think that for the audience, I don't know if you've read this book, it's called The Diving Bell and the Butterflies. I mean, this is Brenda Pierce. This is a Vogue editor, right? That suffered a massive stroke and was sort of locked in. And with only the movement of his eye, he managed to write the whole book about what it's to be locked in your body when your brain is intact. I think that, as you were saying, I think this is a beautiful and an immediate application of BCIs. I mean, what happens when your body doesn't respond to your brain and your brain is intact, or what you guys are doing, at the BrainGate project. So I think this is, and this goes beyond locked-in patients. For example, what about if you are a patient on the spectrum, autism? I mean, can we create new ways to communicate that are not our standard way, right? So I think that's a beautiful application. For neuroelectrics, I'm more obsessed on the therapeutic side. I'm very worried about the mental health crisis that we have. I have 4 kids, and I wonder, when you have a kid maybe with 14 or 15-year-olds with depression or anxiety, just think about that. I mean, there's so many societal strong issues. I don't think it's going to get better with AI, honestly. So, I'm worried about, are we doing everything we can, to provide this therapy? So my obsession lies in using brain stimulation non-invasive, right? And the BCIs, for this particular, but I think there are so many beautiful applications of BCI, in communication, in therapy. And it's still, every time I go around the globe, into big stadiums, and I put the cap and I show my brain, people, I mean, I'm sick and tired of wearing the brain cap. But, but the reaction of the people, this magic of seeing inside your brain, still there every single day of my life, which means that we can still do so much, and really provide applications in which people's lives will be better. But it's a very hard problem to solve because we don't know how the brain works. So, we are not yet there, but I'm optimistic.
This is not supposed to be a political talk, of course, but I don't think it would surprise anybody if, I'd say, well, one great win was if you took all the zeros from the military budget and you put it on the NIH budget, right? That would be wonderful, but I'm also realistic, and I know it's not going to happen. And so I think one solid, well-defined win that I think would really be huge for the field would be the first FDA approval for, FDA indication for implanted BCI, because that's going to show that there is a pathway to commercialization, and there's going to be a way, because ultimately, at the end of the day, it's entrepreneurs who are going to take on the risk of developing tools and take on more and more risk, because they see that there's more and more light at the end of the tunnel. There is actually a way that you can take a product, you can take an idea, you can develop it, you can run a clinical trial, and you can get market approval, and you can get reimbursed for it. And then you can create tools to help you, and then creates opportunities to create new tools and changes those tools. So I think that's I think going to be the first big win, and I'm excited. There's a number of companies, some of them were up there. There's some slides, Paradromics, Synchron, Neuralink, who have clinical trials in progress, and I think are probably going to get an FDA indication within the next 5 years or so. Assuming that they do their trials right and make sure that they run properly, and we're all watching very closely to make sure they do. But I think when that happens, and I suspect the indication is going to be for restoring communication and paralysis. That's really, I think, going to be the first state where, and we've shown in our research, and it's been shown in deep brain stimulators and responsive neurostimulators for epilepsy, that implanted neurotechnology can be done safely. The RNS, the NeuroPace, is an FDA-approved device for treating epilepsy, certain types of epilepsy. And as long as we continue to follow that model of making sure that the trials are run ethically, that there aren't controversies that come out, the last thing you want is to find out that some trial was run inappropriately, and that brings all research to a halt, right? So as long as people are running the trials, are doing so in good faith, following the rules, and make their way through the process to an FDA indication, and show that this is a viable pathway to commercialization, I think that's going to be a huge win. It's really going to, we're already seeing explosion in research, but I think it's going to be a real step function in where this technology is able to go.
Yeah, and one thing I would add is, now it's sometimes hard to recruit people from my company because, when I speak, people say, oh, neuroscience is so cool. And at the end of the day, you come to our office and it's this nightmare clinical trials. We are all writing this stupid paperwork, and design files and preparing for the PMA. And people leave and they tell me, listen, Anna, I want to do new devices and innovate. It's like, well, sorry, I want to get to patients, and it's boring, it's hard.
This is how the sausage is made.
And so it's like this honesty of, there is the hard thing about hard things. I mean, this is hard and it's boring. And if you look me speaking to CROs all the day, I should take stimulation for depression because it's an awful job. But that is what it is. That kind of. And then I say people, well, you go to a company that can innovate every day. We cannot. We have to deliver.
I think that's probably something that is often lost when, as an audience, see a nice video and demonstration of these technologies, is the amount of work and the amount of attempts that didn't work. And especially when we are working in a medical application, in which we need, of course, to abide to the ethical regulations, which are necessary, but that puts a burden. And if here we are talking about AI and neurotechnology, and we see AI bubbling up everywhere, sometimes with basically a path to the customer that is way shorter than the type of technology that we are talking here. And as we get into that and seeing that the wins that you mentioned were all of them in the medical field, but the reality of development of brain computer interfaces is that there is, in parallel, a whole set of applications that are being developed, products that are being developed for the consumer market. So what would be, what is your stance on what are interesting applications, the less so interesting applications that we have in the direct-to-consumer market, or concerns that you may have with respect to that?
I don't know, and people like Tim in the audience, they can jump in, but a lot of entrepreneurs approach me like, and I'm going to do the same at your company, but consumer. And we've seen, starting by Think, remember Think, to Halo Neuroscience, which, by the way, the entrepreneurs were coming from the medical field. They were stellar people, Daniel Chow, to now Hum, which was this memory enhancement band. So I don't know. I actually have mixed feelings. On one side, I think they fail because it doesn't work one size fits all. So there is something on the science and the technology that, remember Halo launched a bunch of products all over for performance. And I think that some of the problems is that it worked for some people and it didn't for others, right? So one part is the science and the technology, but I remember talking to entrepreneurs, especially from San Francisco, and I saying, okay, so you're going to stimulate all these people. Are you worried about, side effects or whether you can harm? And they were looking at me like, no, it's not going to happen. It's like, well, it's like they haven't deeply thought about some, effects of launching into the consumer like that, Having said so, my view is I prefer to start on a sick brain that it's unbalanced and try to balance it out electrically, so to say. than tap into a healthy brain and stimulate it a lot, right? Because I'm not sure we understand if it comes at the cost, if you improve working memory at the cost of dual functioning, I don't know. But having said so, I think we'll see consumer devices coming out. And I just hope that entrepreneurs that launch them have good science, good advisors, and they do it in a responsible way. So that's all I can say. But I will be happy to hear from the audience.
Well, we'll get to that topic also in the other panels as well. But Carlos, you wanted to?
Yeah, so what we are interested in on the side with healthy brains, as you call it, and it's a nice term, is to use the BCI in a different way. Let's call them passive BCIs. So this is a part of the whole BCI field. Even extended a bit more to functions they are driven by the central nervous system, and call it neuroadaptive systems. And there we are interested in mental state monitoring and making decision, not where we have the classical feedback loop when we are in control of something, but use it in different aspects. We use it, for example, in the VR environments, to study reactions of people in the VR, study, for example, errors in the VR. You know, sometimes there is a calculation error, then there's a little jump inside. You can detect this with the brain. There are some examples. We try to use it also to make a system for a learning environment, just to see if we can see in the brain states that whether the complexity of the material is too high, for example, mathematics, for example. Let's reduce this one of the use cases we had for several years now. And so we do little steps in this, but there is our colleague, Sander, who has a large grant on these neuroadaptive systems now, starting now, where they want to do many things. So in this area, and this, if you take care of what you do, as you said, then I think this can be beneficial for all the people.
I'll admit I haven't thought much about consumer use for BCI. One potential benefit that I think could really advance the field, as we all know, AI models take a lot of data to train. So when we work with patients, we're often limited. There's only so many patients who are available, willing to sign up for research trials with uncertain benefits and well-defined risks. And so a lot of our model development is limited by that bottleneck. We have only so many neural signals from so many people. And if there were successful consumer applications, and there was a way in which you could start, building the sort of data sets that you use to create tools like ChatGPT, but with neural signals done in obviously an ethical, safe, anonymized way, that you could have large models so that when you have a patient or someone who has a specific use case, language restoration, speech restoration, you can, rather than saying, all right, now you've got your BCI and we're going to spend the next few weeks training the model so that, you can use this. You can just say, well, we've got, a training set from hundreds of thousands of people who've used this tool. So we're going to set you up and it's going to work within 20 minutes of turning it on for the first time. I think that'd be a huge win and advance for the field as well. And something that probably won't happen until you have good consumer grade devices that are able to record high quality signals. And all of the science and technology is going to go into developing the kind of signal quality acquisition that you can use to train. Again, as someone said, say signal quality, signal diversity, and then quantity. Right. So,
I think there's a very important point that there's still some applications in the consumer sector that which impact can be made, but we shouldn't forget about doing this responsibly. And this point of a potential synergy of say large scale consumer products that can be enablers for medical applications in the provision of data into reducing the cost of technology as well as it has happened in other cases. We're about to reach the end of this first panel, and I reserve this question for last. Don't be afraid. I think we can all agree that the brain is one of the most fascinating elements in the universe. The level of complexity is tremendous and extremely hard to understand just a little bit of how it works. When we look at how brain-computer interfaces and other neural-related technologies are built, they are created using artificial intelligence, machine learning, sensing technologies, computing technologies, robotics. So we can even say that there is no such a field of brain-computer interfaces, but it's more like the integration of other technologies. And my question then is, what is so special and specific of the development of brain-computer interfaces that we need to treat it differently than we do with AI, other data-oriented technologies, or I just want to drop that simple question.
Straightforward enough. I mean, I think you sort of did all in the question itself is that the brain remains, magically unknown, and in the medical space, neurologic diseases remain some of the most untreatable, and there are conditions that affect our very sense of self, dementia and in syndrome. People, fear losing the ability to express themselves, feel losing the ability to even know who they are. These are terrifying conditions, and so I think the potential is huge, unlike almost any other medical technology we've ever seen. But the risks are very real as well, right? There's a lot of risks that we don't see with a lot of other applications of technology. I mean, there's the risk of harm with invasive devices that need to be done carefully. And then there's the risks of the unknown, right? So, for example, let's take that hypothetical example I just brought up a moment ago of gathering lots and lots of neural signals from lots and lots of people to make these devices work ever better. Well, that seems like a great idea, but we don't, we might gather neural signals while we ask somebody to try to talk or to perform a motor task, and then we use that to decode and build a good model. But we don't know what else is hidden in those signals, right? And if we've got a giant data set filled with neural data from thousands and thousands of people, and then later on we discover that we can learn all sorts of other things about people, their private thoughts they don't want to share with other people, or even the potential for, what diseases they may develop down the line. This is, these may be in that data. We don't know that yet. And so keeping the data safe and making sure that as we're gathering data and acquiring the data sets that we need to build good tools, that we put safeguards on it. I tossed in the word anonymize there deliberately in my last answer, but making sure that as we gather all this data, we do so in a responsible way, because there is that big unknown. We don't know what else is in there, and we have to make sure we safeguard it. Thank you.
Yeah, I think that it's also embedded in your question. I mean, I agree. I think that it's so complex a problem that it's a phenomenal playground for scientists and technologists, in the sense that in my company, for example, we do hardware. We manufacture our own hardware. So you have, engineers, you need to work on the sensing part of the brain. Of course, we have software, right? And then, for example, Julio, my co-founder, is working in this computational neuroscience model of the brain. I mean, our obsession is to replicate a neurotwin or a digital copy of your brain so that you can simulate the response of the brain, like flight simulators, instead of, prescribing a drug and then say, come back, or, prescribing a treatment. I mean, can you simulate on the cloud how the brain will respond? This is a playground for any scientist, this kind of, projects. And I think that the complexity of the field requires you to be good in computing, in sensoring, in analysis. And I think I don't see a lot of fields where you can apply so many interdisciplinary skills to solve. It's like almost going to the moon, right? That you really need, to put a rocket together. So I feel the brain is kind of that kind of field.
So I agree completely. I think it's even more important. And
Some?
No, in general, the whole thing is, I think it's more complicated. What we should, coming back to your original question, I think when I use an AI tool on my phone, it doesn't work. Okay, then I don't. Yeah, I want to draw a picture by some prompts. Okay, it's weird, doesn't work. I didn't know how to prompt it. But if I go to a patient and say, come on, we have a brain-computer interface, and it reads your intention of movement, and we have functional electrical stimulation, we make your hand move. I need to explain that so careful that the person understands that we are doing research together at the moment, and not that after half a year, this patient walks out of the room. And this is, I think, one of the differences we have here. And we need to be always very careful when we work with the people that we tell them really what this technology can do and what cannot do. Because if it does not work, I go home in my lab, but I don't know what with the person happens and with the psycho of the person. And this is very important. I think we should not forget that.
Thank you very much. Let's thank our panelists now. So, but before we want to get the polls from the audience, and I welcome Karen Robert-Hanger from the Institute of Neuroethics to lead this part.
Okay. Thank you. Can you hear me?
Yes.
Okay, so you've been sitting, you probably have a lot of things you want to say. So I kind of want to give you an opportunity to react to something. So if you could stand, please. See what we can do here. You're going to probably get close to people and you're probably also going to brush by them. Just have grace and tolerance and enjoy the experience. So we at the Institute of Neuroethics, our Think and Do tank, we're dedicated to trusted neuroscience for everyone and enabling that. And part of what we believe is really important is engagement. By engagement, we mean exchange and understanding each other's perspectives from a variety of perspectives, not just academic scholars, but also civil society and people who are running and developing technologies. So this is a little exercise we've designed, and it kind of built on this past section of where else could the technology go. It's also was the last slide of Sumner's, all the multiple circles of where could the technology go. And this is asking you a series of questions where we'll be getting your opinions. And I will say, we'll ask you to move to this side for radical acceptance. So you'll move your body over there, or you'll go to this side for just total rejection. And then you can be somewhere in the middle. So you're gonna make a human histogram. Okay. So we'll start with the easy one. So how do you feel about getting a tattoo anywhere? So this is radical acceptance. This is like flat out rejection. Rejection of tattoos.
Right. No, I think I'm good. I don't care for one, but if you want them, I was. You're sitting with it, I love the sausage curve, so. Pretty close.
This is like total violation of the body. This is ultimate art in the way a body you define, right? Okay.
Yeah, the cool side.
Okay, let's go a little bit further. What about getting a tattoo of the name of your best friend or significant other?
Listen, I just don't need to do it. It's fine.
To a mom. Okay.
I just was there.
All right. Okay. So, what about a tattoo on your face?
Can we go outside?
Pick one that most resonates with you.
That's what I'm saying.
Tattoo on your face?
Oh, I'm the
Middle.
open.
All right.
Close no doors.
Okay.
Oh.
So even the easy things like tattoos, right? You can start to see there's variation of perspective, even a little twist to it can make you shift. So now that you know how it works, let's go through a couple of neurotechnology exercises. Okay. So a wearable, where do you fit on the spectrum? A wearable device that dramatically improves your ability to meditate based on real-time measurements of your brain activity. So radical acceptance of improving your ability to meditate.
My God.
Total garbage. Let's not do it over on this side.
Throw me through the window. Yes. Touch the wall.
Okay. Okay. So, okay, let's add a twist. So this device also lets you publicly share brain activity to compare with friends.
I lead the room. Keep going this way.
So now, okay, you don't want to compare your meditation with friends, you go over here. Okay, so you might use it for yourself, but when you publicly share it, start to move a little bit. Okay,
Don't look at that.
okay, good, okay. Let's try another scenario. A safety feature that constantly monitors brain patterns of truck drivers for attention. Radical acceptance, radical total rejection. Monitoring brain patterns of truck drivers.
But it's a wearable, we are saying.
Yeah,
We
We're
don't,
still on the
we don't
wearable.
know that, we don't know that. Okay. Okay, so okay, let's add a twist. Let's add a twist. Time driver pay rates to brain data driven interpretations of the safe driving behavior. You're gonna go out the door?
Fair enough.
What if you, the driver pay brain data insights?
Safe.
You mean insurance?
Salary.
Salary. Okay,
Sure, touch mic is-
okay, so this is moving a little. Let's try a third scenario and then we only have one more for that. Okay. What about thought to text earbuds that allow rapid social media posting?
Sorry, can you?
Thought to text,
Yeah.
thought to text
Yeah.
earbuds,
Can I just tell somebody?
right? That allow rapid social media posting. Thought to texting.
Oh.
Yeah.
Still deciding, okay. So what if,
Bimodal distribution.
what if these thought to text earbuds that rapidly post on social media also have automated meme selection based on your mood?
Are you choosing to
It's automated
based on your
meme selection.
No, I know, but are you choosing to post it or is it posting without you choosing?
You have to pick what is in your. Okay, well, someone left the room. Okay, just one last one. I guarantee that all wearable devices allow users to own their own brain data.
Sorry.
Do you radical acceptance of a guarantee that all wearable devices should allow users to own their brain data? Or over here, just total rejection. They shouldn't own their own brain data. Okay, that's good. A lot of people kind of, okay, I guarantee that you should, okay, what if this is only the case with a premium subscription?
Karen, this is sports. Go all the way back again.
General.
Subscription for, okay. Okay, so from this, I think you could see how some of your opinions aligned with others, some of them didn't. If we had a longer time, I'd have you discuss a little bit with your partners why you moved. But I encourage you to do that during the other break if we have time, and to keep these ideas in your mind, but then the nuance, actually, the context matters. And that's the type of thing we'll be discussing, I think, a little bit more in the next section, right? Okay,
Thank you very much.
thank you.
We'll take a quick 5-minute break, and meet back here at whatever that is, 16 past.
Here.
She gave me the coffee for the session.
Need something.
You know, Spanish speakers speak. Oh, okay, I will. I'll slow down. I just like.
I'll show you.
Yeah.
Yeah, it's like,
BCIs, it's like. All right, two slowdowns for I'm gonna blame it on her. She gave me a copy of and then we'll have another panel, and this one's gonna be like forward looking. And then like one more session after that. That one is going to be recommendations for how to make.
Yeah, I was there.
Yeah, it's nice to bring it, you know, think of those. Yeah. That was. Yeah.
So that's the undercut of my
Did I hit the mark for you on the conversation?
That's a good way.
I think that's
They like a scan.
okay, so they're terrible motor neuron. Speed is very slow. I think even that. But what it is, it's very really wide. It's much more precise. And then well, I mean, we can go up to 1,000, but it doesn't matter because it's dynamics. So rise times are a second and a half.
Well, I actually don't use my real name, so.
Here, this is stable over here. So we maybe we put it on day one.
Live interview with AI legend Dr. Jeffrey Hinton is about to start right
So
now.
I think that's important.
Go get your spot on in the ground or room D on the first floor. See you soon.
I don't know how. There's a lot that's gonna do. Someday, I think.
Yeah, I'm ready.
Yeah, if you want to be, yeah. I think, yeah, right now, the way we're doing it.
Yeah, you want to do that.
So right now, it costs about. I would imagine this is a facility generations to scale it. And like.
Yeah, so example, so
Yeah. So if you don't have scale, you know. Yeah, I think even now. Yeah, and we're gonna have, so we're just trying to, try to have. Compare that. And. Yeah, and I have a literal scanner in my back, I get there. Well,
That's the challenge.
we're getting this word here. Bill, right, yeah, love it. There's a climate one, there's a no, I mean, I don't think it actually. Yeah, he also includes the idea here, but like, it's really about. $1,000.
To be honest, it's like. Yeah, yeah, PhD. Yeah. Developing haptics research. It's very. We're doing something that's why they. Yeah. No, I was about to, I didn't realize. There's a lot of research done on it. Many opportunities. Yeah. Yeah, they're doing a senior start. Sorry.
And then the others can help you can go ahead. So. You see that results are doing something as a kind of answer here.
Again, there seems to be an increase. Negative bias when it comes to applying the auditory neuroscience. I think the primary issue is that. Second reason is that. Swing is harder. I give you a great solution. Yeah. I've seen people. I need 9 months.
Nathan is moving this hand with his brain. And so when he was giving me a fist bump for shaking my hand, these are his own signals that he's sending out that are manipulating with pretty amazing precision what this robotic arm does.
Yeah, I think it's true.
Another thing you need to understand. So like big like. For the first time. They look pretty. You know, like social
O sea, tienes que
Cheers, I said very close. Yeah. Like this.
We got entire paper.
Sarah, let's see that projection. If you don't mind.
Switch. Really depends on. Data protection. Please.
I say that. Go and ask for permission. Call now, but it's okay. Shut down.
This is really a waiting situation. I love it.
Any of them have that?
Okay, everyone ready? See the clap thing? Clap once if you can hear me. Yeah, clap twice if you can hear me. Clap 3 times if you hear me. Clap 4 times if you hear me. Clap 5 times. Thank you all for coming back. We're a little bit behind schedule, so I'll be very brief. And I'm going to introduce a good friend and colleague, Terrence Southern, who's been in the space for a long time, both AI and neurotech. She is an advisor at BlackRock Neurotech and a storyteller who has put out an incredible amount of information in both fields. And so I'll just stop there and let her take the stage. Please welcome Terrence.
So that moment when the jet lag hits you and your brain turns into fondue. That happened like an hour ago. So, but I'll keep this relatively brief. I think Sumner did an excellent job of summarizing state of affairs, what BCI is, what it enables, what it does, sort of all the different technologies that are currently available. I'll just talk a little bit about, before our next panel, what inspires me, and I think, kind of the people that we should be talking to and conversing with in order to look to the future. And that is the users themselves. We spend a lot of time with researchers, a lot of time with CEOs and founders. I've had the good fortune in my 7 years of working as a storyteller in this space to work predominantly with patients. And obviously it's very rewarding. You can be having the worst day of your life and nothing sort of makes you sort of feel better about your own situation than being on a phone call with someone that can't feed themselves. And so I feel very lucky to call a lot of these people that you see up here friends and to get to know them and their stories. So I just wanted to kind of walk through a few of what I find the most sort of awe-inspiring applications are that they've been using their interfaces for, and how they have been shifting the use cases of these interfaces by way of their own personalities, their own aspirations, their dreams, because I think we need to be paying attention to that when we think about what are we developing these technologies for. So first, just like quickly, a spell of headlines just over the past 10 years. I think the headlines often serve as a sort of inspiration jumping off point of what is to come. And I have a quick slide here, which we don't really need to talk about, but growing market in neuro interfaces. So this is Dennis DeGray. He had used I'll just play the 6th video.
Year-old quadriplegic was writing a sentence on the computer screen in front of him using only his brain. A former volunteer firefighter, DeGray had a bad fall 2 years ago, which severed his spinal cord.
To move the pointer around, I imagine a ball lying on a table with my hand lying on the ball. And as I roll the ball forward, the pointer goes up. And as I roll the ball back toward me, the pointer goes down. It's very liberating to be able to utilize a portion of my body that has not worked to actually cause an effect is great fun.
Dr. Jamie Henderson is a professor of neurosurgery at
So that's incredible work at Stanford, and Eddie Chang at UCSF has, what's that? Is it? Oh, this one is the one that, I'm like, why isn't, there we go. I'm sorry, everyone. Again, brain fondue. And Eddie Chang at UCSF has been sort of building on that, doing really incredible work with thought to typing. And I actually, an article just came out, I think yesterday or today, about how he's using AI to now have the neural nets translated into different languages for his patient who is bilingual. Very exciting. Here's Nathan Copeland out of the University of Pittsburgh shaking
Nathan is
President
moving
Obama's hand.
this hand with his brain. And so when he was giving me a fist bump for shaking my hand, these are his own signals that he's sending out. That are manipulating, which, you know, pretty amazing precision. What this robotic arm does.
So we've seen typing, we've seen control of a robotic arm. Here's Nathan in another experiment with sensory feedback, so tactile sensation being transmitted back into his brain.
Because I'll be able to, and someone needs to. Today's the first day that we were linking the signals to the robot arm. Apparently it worked great. I couldn't see, but it felt like I was getting my fingers touched or pushed, and they tell me that I did it right. Index and middle. Did you just do more than one, or am I going crazy? Hanky. Middle. Hanky. Oh.
20 out of 20, everybody. Old video. Here's some more applications of Nathan.
Channel, BCI can do better. You can see that not only could he feel through the robotic arm, but he could control it really well too. He's making a mixed drink of sorts in this video. This clip shows Nathan using a BCI controlled mechanical glove to feed himself a taco. As you can see, Nathan loves using his BCI to play video games. Here he plays Final Fantasy, a complex 3D game, and he's absolutely destroying a bad guy. And finally, Nathan frequently uses his BCI to paint pictures, which he later sells as NFTs. By the way, Nathan, I'm super jealous of your multi-monitor setup.
So one of the cool things during COVID, Nathan became one of the first patients to actually have his system built at home. So he could take what was being done in the lab and actually do it from home. And he was spending so much time creating art and playing video games and all of these things that he couldn't previously do, which was really exciting. He also set the record for wearing a brain computer wearing for the longest implantable brain computer interface. And yes, as the video mentioned, he also created the world's first BCI NFT. He's very into blockchain technology. He was really excited about being able to actually sell his art. You know, this is an important thing for the patients to be able to get back to work, whatever that looks like to them. Whether that's, you know, writing, or one of our patients wanted to go back to being an accountant, and Nathan really wants to be an artist and do this kind of Japanese anime style art. And so I actually got on Zoom with him. We set up a wallet, and we sold his first NFT for 2.5 ETH in 2021 during COVID. And then following that, we have, here's some of Nathan's art that he's created with his BCI. We also have some art that I showcased yesterday. If any of you were at the session with James Johnson out of Caltech, he also has been working on art, but they work in different mediums. Nathan's more of a paint guy, whereas James is more of a Photoshop guy. And so we thought it would be really cool and fun to showcase our patients' art in an actual gallery. So we opened a gallery last year in Washington, DC for a special run for 9 months. And that's the art gallery. And we got to invite a bunch of people out from the government and the FDA and people that don't normally get to see this side of the devices and meet the patients and hear their stories about how, you know, they're sort of taking unique control and ownership over how they use these devices and the pleasure they get out of them. So, yeah, I mean, I guess like all I wanted to just say from this short talk is just, as we sit here and we talk about what's next, what's to come, thinking about what it is that the patients themselves desire is incredibly important. I'm not saying I play this video because I know we're running short on time. Anyone who was at the talk yesterday saw it, but our patient James, who's based out of Caltech, like his dream is to be able to has been to get behind the wheel of a car again. So in collaboration with Caltech and a major automobile manufacturer, we created this experiment to enable him to do just that. And we showcased a video clip of that. But these are things that we wouldn't necessarily think are important or the priority set for patients. And it's been really fun to dive into it through that angle. So with that, I'd like to bring up our panelists to talk about the future of BCI.
All right, I guess we're gonna go microphone now. We found it, so. All right, could I have each of you guys
Just give a very brief intro on name,
Shall I sit there?
where you work, what you do.
and maybe one fun tidbit if you have one ready.
Sure.
So my name is Tim Mullen. I've been in the neurotech space for a while now, building neurotechnology solutions for about 20 years. So I've seen a lot of different stages of evolution of this technology, not as long as some of the other folks who are here. Darren, for instance, a great pioneer in this space. But one of the things that I've done over the last 12 years is build neurotech companies and startups. So I'm a founder of a few different neurotech startups, including Infion, which was founded about 10 years ago to pioneer the ability to take data from various different sensor devices and apply decoding algorithms in the cloud anytime, anywhere, and translate that into a variety of different applications, sort of BCI, anytime, anywhere, all in a pervasive context. And I've also founded a company that does ultrasound neuromodulation for brain stimulation, and a founding team on a number of other companies in the mental health space.
Hello, everybody. My name is Machali, and I'm a professor of ethics of AI and neuroscience at the Technical University of Munich in Germany, and a group leader at BFL, so next door in Lausanne. And I work primarily, so my lab and I work primarily with one foot in the science and one foot in the ethics. On the science side, we focus mostly on ethical by design development of brain-computer interfaces. We do a lot of studies with patients on how to incorporate ethical considerations early on in the design and development phase of BCIs. And on the ethical side of things, we work primarily on issues such as privacy, autonomy, consent, how to implement these mechanisms into design and development of new tech products, which also has obvious policy implications, because probably, as we will discuss in this panel, a lot of intergovernmental organizations are currently active in developing neurotech regulation. So, for example, I've been working with the UNESCO ad hoc group that has been established this year to develop a recommendation on the ethics of neurotech. I also advise other organizations like the Council of Europe and the OECD that are active in the space. Yeah, I'll pass it on to Milena.
Hello everyone, my name is Milena Costas. I come from Spain. I'm an academician, I come from the academy, and currently I'm here in my capacity of member of the Human Rights Council Advisory Committee, which is a group of experts. We are independent experts, and we provide advice to the Human Rights Council on human rights aspects. And in that capacity, we received from the Council in October 2022 a mandate to develop some study on the opportunities, impacts, and challenges of neurotechnologies on human rights. And so I'm in that capacity. I prepared, let's put it, and I was speaking about the right side. I'm more in the dark side on the risks, so I'm very focused. That's why I was in this area all the time. I think our work from the human rights perspective, and I think that's what the message I would like to convey today, is that it's a job that is not specifically confined to experts on human rights. I think this is impacting everyone, and so I think what I would like to bring is that view, like more open-minded to the political side and also the policy side on how to regulate this in order to favor also development and innovation at the same time. Thank you.
Anna said, don't worry. It's gonna be
Sorry.
fine. Anna said, don't worry. It's gonna be fine. Okay, Tim, 20 years. Can you draw a trend for us? If you go back 20 years and think what was going on in BCI then, what's happening today, and then, no pressure, but exactly where are we going to be in capabilities 20 years from now? That's the question I want to answer.
Oh, great forecast. Yeah. Well, interestingly, 20 years ago, I had a lot of beliefs about where I thought we would be in 20 years. But about 20 years ago was roughly the start of wearable neurotechnology. So that really got its start in maybe like 2004, with companies starting to put little small sensor devices on people's heads and recording EEG activity and gamifying it. So I think about 20 years ago is about when the concept of a BCI moved out of being strictly in the academic space and started to become part of a public conversation. Not nearly as much as where it is today. I think the trend the progression of the trend is something that I think Anna mentioned actually in the previous panel, that the technology is moving along, it's progressing. There are limitations in exponential growth with brain technologies for a lot of reasons we'll talk about, but there are areas where it's growing very quick. But the public perception and the public understanding of BCI technology has changed dramatically since when I got in the field. So that's been very interesting to see. One of the areas that I've been seeing happening over the last 20 years that's impacted me specifically, because a lot of the technology I work with is non-invasive technology, has been the ability to combine data from multiple different sensor modalities to make better inference when you have noisy, low resolution, say EEG sensors, brain sensors on your head, but you can combine it now with other contextual data from other sensors that people are already wearing. And that's starting to become very exciting and useful. Another thing that's happening in the trend is moving from simply, read devices and then separate write devices to more closed loop neural interfaces. Forest Neurotech, which Sumner is amazing project, is an example of that, where you can do non-invasive brain stimulation or invasive brain stimulation, depending on what you want to do with it. I do it non-invasively, Sumner does it invasively. Either way, you're able to take this type of technology and now stimulate deep brain circuits. And when you can read the response, you can create a closed loop circuit. And that's totally changed the landscape for BCIs. Where are we going to be in 20 years? I don't know if I can really forecast 20 years into the future anymore. 10 years into the future, I think what we're going to see are a couple different things happening. AI right now is allowing us to improve our decoding models very significantly, the modern advances in AI. So we've been over the last 5 years able to do a lot better at, say, the multimodal sensor fusion I was talking about, being able to incorporate different types of modalities, make predictions. I think that's going to improve pretty dramatically, and that's going to lead to some really interesting advancements in the BCI technology. The materials, I think, are going to improve dramatically for implants. And I think part of that's going to be driven by AI-based material design. So part of what I think is going to happen is the advances in AI are going to be driving advances in material science, which leads to us understanding better types of technologies that can be pervasively implanted. And that's going to let these devices actually work for long periods of time. I'll pass it on to the others because, there's probably a lot of other things we can talk about the future.
I'll ask a follow-up question, which is either of you, so feel free to pick who, any reactions there? Is there anything in there that made you go, whoa, whoa, whoa? We need to think more carefully before we just create that. Whoa, whoa, whoa.
Yeah, I can speak from the perspective of our study. So what we are seeing, I mean, I'm an outsider, so that you have to understand that, and I'm also a jurist, so I'm always in that side, or whoa, 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 more than easygoing. But I think what we see is that obviously there are a lot of opportunities, and this is a great advancement for the health of people. So I think we cannot hinder the innovation and development for the good of people. We are talking about the AI for good. So we have to speak about neurotechnology for the good of the people. So I think that is for clear that we cannot hinder this kind of development. At the same time, we can see that most of the developments, the good for people is in the medical field. And so what we should be asking today, I mean, we are not questioning that. I mean, I give that for granted, that whenever something is going to help people, I mean, we will develop that. Why not? But at the same time, we should be questioned in which framework we are developing that, and if we can keep the pace of the advancement for that, and if we are ready also to digest all this kind of technology. So from the human rights perspective, I think we have to look at our framework in our countries. We have adequate framework to defend the rights which are being challenging or will be challenged in a short term. At the same time, is that framework applicable in other countries as well? Because we are in a globalized world, so technologies are going to be sold or tested everywhere. So that's for me, also the questions that we have to pose to make it today. And finally, are we able to find a consensus at the international level to meaningfully protect the rights that are at stake? So I think it's important also is not to think very inside us or very isolated way, but it's important also to see the whole picture, I think.
Yes, I have a slightly different answer to the whoa question, because anytime we talk about ethics in the public, the immediate perception, that the immediate intuition that people have is that ethics is about whoa. And I think this is a misconception. There's certainly one pillar of ethics that is about the do no harm principle. It's about preventing harms. And this is a fundamental part of what ethics does, but it's not the entire construction. So it's not the entire thing. There's another fundamental pillar, which is promoting the good. So we should not simply prevent harm, we should also promote the good. This conference is called AI for Good. So this entire conference is fundamentally a conference about ethics. And we currently live in a world where based on the most recent Lancet Neurology report, 1 in 3 people alive today are going to develop at least one neurological disorder in their lifetime. And 1 in 2 are going to develop at least one mental illness, at least once in their lifetime. This means that only at this conference, we have several hundreds of people who are going to be in need at some point. We cannot cure what we cannot understand. And there's still a lot we don't understand about the human brain, and we cannot understand what we cannot measure. So we need to accelerate the development of technologies that can help us measure and understand the brain in order to develop much needed solutions for people in need. And if we don't do that, if we introduce unnecessary obstacles in this process, this is not something ethically neutral. It's actually something ethically detrimental. So I think that's a very important thing to highlight. Then, of course, we have to emphasize the impacts and the potential negative impacts that certain misuses of technologies can have. And certainly, the more the technology can interfere with fundamental aspects of the human being, the higher the risk that this can happen. So technologies that directly interface the central nervous system and the brain in particular have a potentially higher potential to do so, and therefore we need to monitor and scrutinize the human rights impacts. And I fully agree with Milena on this. So together with Roberta Dorna, I'm the person to blame for having introduced this notion of neuro rights to monitor the human rights impacts of neurotechnology. But again, human rights impacts doesn't only mean human rights violations. It also means how can we promote the human rights framework within the context of neurotechnology. Because again, we live in a world where half of the world population doesn't have access to basic neuroimaging technology. And 99.9% of the world doesn't have access to the beautiful advanced BCIs that we've seen here. So also, how can we promote the right of health of the entire world population in the context of advancing neurotechnology? I think it's a fundamental human rights question that we need to address.
I would add one thing that's happening in the progressive trend that I think supports some of this, especially point of equity. is the drive towards reduced cost of these devices, which has dramatically changed over the last 10, and the next 10 years will be order of magnitude also cheaper, these devices. And so that's at least one aspect of it that I think is progressing in the right direction. And the other, in terms of general access, is the very conversation we're having here. Like 20 years ago, even in the neuroscience community, it felt like there weren't a lot of people who exactly like knew what a brain-computer interface was, or like it was a pretty small community actually. 25 years ago, even smaller. And now these conversations can be happening on global stages that allows us to talk about these points. So I think those two things are going to act in favor of that.
Any hot takes?
Just to say that I agree with Marcelo. I mean, that in the end, I think it's important also to set the boundaries. I mean, it's difficult nowadays to speak about the clients, but I think it's also our responsibility to be very conscious about, the world we are living and the uses that is, where this we can lead in certain countries, and also to link human rights, first of all, ethical, which I think is the core values of the human being. But then human rights is like the translation, as you know exactly with the neuro rights, is what you try to do, the translations into a normative framework. Very important to have a very cross-cutting principles that permeate all parts of the national legislations and also international legislation, and also in order to translate this and to favor the development of technology. So I think there is this misleading understanding of human rights, as you mentioned, also with ethics, which is something that is going to hinder development. And I think, no, we have to, to send the message that what we are saying is like, also we need to have some kind of democratic control on what is going on. So I think it's a kind of transparency and to open also the discussion to other people, which is not confined just to expert groups talking about this. So I think the cause of human rights is more this discussion than, see things like putting boundaries to the good things and good developments. Is to speak about the shadow phase of the technologies and how can we mitigate these impacts or accept that sometimes we cannot mitigate for the time being. So we need to build a more protective framework. So I think this is what I try to convey.
How many people here have a relative or a close friend that has a neurological condition that is severe enough that it's visible, it's affecting their lives? I'd be surprised if it wasn't everyone or close to everyone. And I think, to your point there, I think there's about 21 plus million people in the US, I don't know the numbers for Europe offhand, that live with severe and treatment resistant, as in they have failed at least 3 drugs, forms of neuropsychiatric disorders. And every day they go without solutions. We've effectively failed them. So I want to ask, how do we know if we've succeeded? What's the metric by which we can measure success? And I'll give one, and then you can tell me if it's the right or wrong one, and then give an alternative. Which is the UK NHS will offer reimbursement or health services for certain devices that meet a minimum bar for quality adjusted life years or QALYs per pound, British pound spent. Is that the right metric? Or is there something else? How do we actually know what we're optimizing?
That's.
I'm sorry? Please. I don't know as an acceptable answer.
Well, first of all, here we are close to UN premises, and one important point to highlight is that the definition of health that UN has imported from the WHO is that health is not just the absence of disease. Is a state, a holistic state of human well-being, which includes physical, psychological, and sociological well-being. So definitely adjusted life years and QALYs are good metrics, but they are partial ones because they're only applicable to people who already have a condition and we want to improve the health outcomes of that population. But a lot of another big chunk of metrics should be related to prevention. How can we prevent the onset of severe neurological and neuropsychiatric conditions? And we know that if AI is good at one thing, it's about prediction and early detection. So also leveraging the potential of AI in the field of neurology for preventative and early detection purposes, I think it's very important. And then I think there is also this social dimension. Certainly, we need to look at biomedical metrics, but I think what also counts a lot is what is the level of reintegration that people with severe neuropsychiatric conditions can have within society. And we have seen a lot of beautiful examples in the previous presentations are people that were completely cut out of the social world. And locked within themselves, especially the locked in patients, but also those who have a lot of other conditions that make communication with the outside world very, very difficult. And reintegrate that function of social interaction is extremely important.
Well, I mean, I think that you're getting at, I think, a very important question, which is how you quantify something like human flourishing. And now we can spend an hour talking about the philosophy aspects of this, and it's actually a very important discussion. And
you have 2 minutes.
Yeah, we have 2 minutes. So the greatest human question, that really we've been asking for thousands of years, how to live a life well lived. But at the end of the day, there are quantifiable metrics, of course, we can use around things like rates of depression, whether we're reducing that, whether we're reducing, in a preventative context, even the emergence of these phenomena. I think it's important that we look at this as a multidimensional problem. So, when we're talking about things like mental illness or other forms of mental suffering, it's not just a one-dimensional problem, like, relief from suffering for an individual, but it's also like things like fulfillment in their life. Are there other aspects of, say, service and community or that we can cultivate? Are there other aspects of insight or wisdom that we can help with, all of which will give rise to solutions that help reduce the likelihood of, say, anxiety and depression emerging within a community. How to quantify that, I don't know, actually. I think that's an extremely challenging problem. But I look forward to such a quantified solution emerging because it'll make my life a lot easier.
Okay, so quantification is difficult, but I do think that we can all probably agree that the voice of the user, the participant, the patient is really important. And I think we're seeing, in some cases, we've seen this with Wellcome Trust and a few other foundations that are funding neurotech efforts, a lived experience expert that has to be involved from the beginning, at the foundation of it, into the planning, and all the way through the end. And we see people like Taryn who are bringing the voice of these BCI pioneers to light that just didn't exist. I mean, the first SFN panel that had actual participants was just a couple of years ago. That's crazy. So how do you guys think about integrating the voice of the participants themselves when you are kind of mixing that into the milieu of the other metrics that make no sense?
I think it's phenomenal to bring, I think that's, yeah, no, I mean, I think that's absolutely crucial, is to bring the voice of the user into the conversation at the earliest stages, even of the design and development of your technology. It's super encouraging to see these voices become present in a forum where we're talking about where this is all going. Because who is it that we're building it for ultimately? And, it's for the improvement of people's lives, and we need to understand what is it that we need to be improving and what aspects of others' quality of life. So yeah, all for it. One thing I'll also mention is just that the earlier you can get your end user involved in the development and design, even at the research stage, the better. Like all too often, I've seen technology that progresses pretty far along around a vision of what could be done with it, and you bring it out into the world, and getting that match with an actual use case that matters, it becomes so challenging. And if you get users involved at the very earliest stages, even in labs, having more of that interaction, I think it will help increasingly in the translation for the good of everybody.
Yeah, I fully agree with Tim. Luckily, we have a very functioning, well-functioning framework for doing that, which is the human-centered design framework, patient-centered design framework. And I think its applicability to neurotech development is huge. What I would like to see is the human-centered design framework applied not only to technology design, but also to policy design, for example. And I think what is missing currently is the actual involvement of end users in helping design the policies that are being developed at the national and international level. So I'm more than honored to serve on expert committees and intergovernmental organizations, but I don't think that these policy efforts make sense if they are so top-down, technocratic, expert-focused, and do not involve the end users in the design of this policy instrument. So I think this is really something where we should do better.
Anything to add?
I mean, from the human rights perspective, I think it's very interesting, and also there's a lot of they stress very much the fact that we have to involve also people with disability, persons with disabilities into the, all the research moments. And I think that's for sure very important area.
Okay, I want to pose an open question. As we move into an era where commercialization of BCI technology is becoming more and more prevalent, how are the organizations that you, Milena, and you, Marcello, how is their thinking evolving to keep up with that shift?
The shift from the clinics to commercial applications?
I mean, commercial applications can also be in clinics, but an increasing amount of funding, increasing amount of effort and people that are bringing in commercial efforts, whether it's Neuralink, synchron, or non-invasive approaches. But the amount of academic work is following funding trends, which is to say that it's fairly even. But the amount of people and effort going into commercial is going way up. And that brings a whole host of changes in the incentive structures for everything from data privacy to involvement of the patients that we've been talking about and beyond. So I just want to ask, what are the organizations that you're involved with doing to keep up with that?
Well, so first of all, I think the spotlight, and I fully agree with Anna here, is a good thing. I think it's very important that neurotech is dragging much more attention. Now it's certainly at its peak of public visibility at the moment, and I hope this is just the beginning. And this spotlight is definitely very important also for policy, because it's necessary to make policies that are democratically accountable. If you develop technology policy for a niche technology that nobody knows what it is, it's very hard to make it in a way that is publicly informed and that can incorporate within a democratic framework the points of view of the majority of the population. So I think this is very important. But then, of course, if neurotechnology goes mainstream, that's also going to raise additional challenges for policy, right? So, for example, neural data protection or neural data privacy is a topic that we've been working on for many years in the neuroethics community. But then, of course, the more neural data will be collected and processed in contexts that are underregulated, for example, outside of the research domain and the clinics, then the higher the chances that this could lead to potential misuses, and these misuses need to be anticipated. So, for example, with the International Brain Initiative, we are now developing a framework for ethically aligned data collection and processing of neural data within the IBI, but beyond, because we thought part of our responsibility. So for those who don't know, that the International Brain Initiative is the federation of, or the umbrella organization that federates all the national or supranational large-scale neuroscience projects in the world. And there, part of our task was to develop ethically aligned framework for the collection and processing of neural data, especially focusing on AI processing. And then we thought, well, we cannot limit this framework to the IBI alone, because the boundary between different domains of applications of neural data processing today are going to be blurred. by this commercialization trend. So we need to have a broader focus that incorporates also potential uses outside of the research domain. And I think that's probably the direction where also legally binding frameworks are going, because this is just ethical guidelines, which are persuasive in character, but if you don't respect, if you don't comply with them, nobody's going to send police to your home. But then there are organizations that are working on legally binding frameworks. So the Council of Europe is contemplating this. There are proposals to amend the General Data Protection Regulation in the EU to consider neural data sui generis category like genetic data. And if these efforts continue the way they're going right now, I think the importance of having well-informed decisions about governance is even higher.
Do you want to add anything to that, or if not, I can do an open floor for you too.
I think from the Human Rights Council perspective, it's important what Marcelo is saying. And I think above all that the initiative for this study that we are producing, I mean, speak the attention of a lot of countries. So a lot of countries support this initiative. And what we are seeing is that there's this lack of framework, like a very reliable, and this is good also for companies, I think, to have some kind of legal certainty on about what they can do or what they cannot do. And for me, it's very important this possibility to interact with other organizations which are now also developing these frameworks from the ethical point of view, like the UNESCO. And hopefully this will lead to something that is more, kind of guidelines for states also to develop their national legislation as well.
Okay, this wasn't necessarily planned, but I want to make sure, because I think we're gonna have to skip the break to catch up. If anyone has any questions that they'd like to ask the panelists before we move into the next section, now would be a great time. I know I'm putting you all on the spot a little bit, but if you have any burning questions, yes.
Yeah, no, there's a lot of talk about incorporating the end users specifically within the realm of patients, but not as much, at least specific examples or commitments to talking with industry. So I'm curious how specifically you two, like, how do you engage with industry? How do you make it part of your practice to understand who's on the other side of the spectrum and how to build with them as opposed to against them?
You mean with the, sorry, can you say again? I mean, how we
How do you incorporate the sentiments, perspectives, realities of companies commercializing neurotech into the guidelines that you build out?
I mean, for the time being, we are just, at least from the human rights perspective, we are just working on the work that has been done already by several bodies. So it's like bringing together what are the human rights approach to the development and the deployment of these technologies. And obviously, we don't have a lot of practice on that because, this is emerging technology. So there is not a lot of practice, but this is the principal approach that human rights provides, that you can bring other areas where you have this practice into these guidelines. Once I think we have to get in touch with the technological developers as well in order to incorporate that. But I think this is kind of dialogue that we have to undertake once we have already very clear what is this human rights approach to neurotechnologies. So I think we are still in the stage of defining after the ethical work what are the main issues and rights at stake. And then I think we have to undertake this dialogue with the companies.
You don't think it's like fundamental to know how these companies are going about their business before making those decisions?
It is. I mean, I should say as a caveat, I'm primarily an academic who is serving as an expert advisor to policy organizations. So I cannot speak on behalf of any policy organization. But for example, the work that the OECD did during the development of the recommendation of responsible innovation in neurotechnology was to have an entire implementation phase during which all the neurotech companies in certain world regions were contacted, and there was a lot of involvement of private sector actors. Karen was also part of that process, so a lot of companies participated in that. With the UNESCO declaration, recommendation.
Recommendation.
With the UNESCO recommendation, now the expert group has produced the first draft. And from now until mid-July, there is a phase of regional consultations where the document is open for input. Those consultations will involve the entire civil society. Industry actors are more than welcome to participate in this. I think to give a concrete suggestion, the best thing you can do is to reach out to the permanent delegation of your country to UNESCO, because they are coordinating this regional consultations, and make sure that your company is part of this consultation process. So, it's a sort of free entry program. But I think it's extremely important to collect as many inputs as possible in this phase. This is happening in a decentralized way because it couldn't happen in any other way. But I think this is a fundamental part of the process.
If I may, yes, I forgot to say that, for example, in this study that we are developing, we launched a questionnaire and we try to get as much as possible answers to this questionnaire also from technological companies, but unfortunately we didn't get a lot of that. But I think we are now working in a very theoretical level, and I think in the next stages we will, as Marcelo says, try to interact with more closely with companies and developers.
Okay, quick response. No, we're gonna have to move on. It's a long response.
No, it's just, I think it's challenging to expect companies to reach out to add their voice when they may not even know that the thing exists. Like, for example, in the US, there's an organization called GAO, the Government Accountability Office, that specifically reached out to various levels and types of neurotech companies to provide feedback and consideration of how to draft policy that affects the US government and how they craft BCI neurotech legislation. So if there's anything to pull from that, I highly recommend keeping that in mind.
I'd also just say there's a number of standards initiatives that touch on this and have for a long time. And so the BCI roadmap, for instance, is another example. It's something that was developed. Ricardo, somewhere here in the room, is very central to that. And the other people in this room were. That involved a lot of companies, and generally speaking, the IEEE is a great resource to go to for looking at any of these standards initiatives that couple very closely what my colleagues here are talking about. So yeah, I mean, yes, people may not necessarily reach out to you, but the IEEE and some of these organizations do have open calls for participation.
But if I may just jump in.
Very fast.
Yeah, but very quick. I understand your frustration, but I think you should also see it from the other side of things. And again, I'm not on the other side of the fence, but policy organizations do not have a chief neuroscience advisor that can inform them about, who are the most important neurotech companies, what are the most important publicly funded neurotech labs in the world. So reaching out, I know, can be frustrating, but I think it's important because mostly, the people will send invitations to participate in this or that event or to participate in this or that consultation may not necessarily be people who are knowledgeable about the field. And that's very unfortunate, but it's the reality. So I think being proactive can be frustrating, but I think it's also very, the best way we can do that. But we can talk about this later.
Can I add something quick? Just to add another company perspective. I think everyone can agree there's a huge problem. Someone brought up 21 million people in the US with, treatment resistant mental health diseases. The only way those 21 million people are going to be served is through companies, right? Companies have to commercialize their technologies in order to get it out and serve those people. So if you put too many barriers in place for companies to build those products and serve those people, they're never going to get served. So I think that's the one thing we should recommend. And if you don't have experts, you should get curious and ask questions and find the experts because they're out there and plenty of us are willing to talk. And no one's come to me either. So
I'm not complaining that one came to me. My question was, what do you do?
Let me drop one thing. When the FDA yeah, I just taking advantage of my role. When the FDA started to launch their their recommendation for implantable BCIs, they opened a consultation and they only got 21.
Yeah.
So just to see that the problem comes both ways, and we need to discuss about solutions, which is the topic of the next part.
Yeah, well, last thing on that is,
Ryan?
we're heads down. We're not looking at everything the FDA does. We're trying to build companies to build products. So if you want our input, you have to come to us. We have websites, SEO, it works great. You search some keyword terms, you'll find us. We're there, we're not hiding.
The same with people with lived experience.
We need Tinder
So
for.
if you want.
That's our
I
next.
know you
step.
had
My
questions, you
question
waited a long
was
time.
widely covered by this interaction,
Okay.
actually, no, fully.
But
And
I
by the
think
next
actually,
panel, I
this
think.
is perfect because Ryan, you said the word recommendation.
Yeah.
The third session is for recommendations. I want to make sure we get Dr. Botinger up here. So we're just going to move on very quickly. Thank you all.
My question was asked, what do you do to engage with the industry?
There was no answer.
We knew that time would be a challenge because the topic is so complex and there are many things to address. So we move to the last panel of the day, when we will focus on what can be done to improve the situation. And we have seen that there are several things that can be done and several aspects. And I will have here four panelists represent the different types of the stakeholders that are involved, not all of them. And I will just
I would listen to the chat.
briefly introduce yourself with your name, your organization, and main focus.
Yeah, I'm urban volunteer. I'm a medical doctor, life scientist by background, not a neuroscientist, another neurotechie. So I came to the Leeds Center for Bio and Neuroengineering a little over a year ago, from the perspective of leading the Leeds and turnaround and making it what it was supposed to be. That is a not-for-profit translational R&D organization that takes promising concepts and discoveries from TRL2 to TRL6. Now you know, right? TRL2 is we're working with academic centers, university faculty around the Lake Geneva, EPFL quite a bit, University of Geneva, HG, we are here in Geneva, and do de-risking and establish feasibility proof of concept, and then apply an engineering cadre for hardware, software, and AI and algorithm development to take things to prototype stage, TRL6. We don't do clinical development. At that stage, we now have a business development unit that takes these projects into a startup mode, a spin-off. We like to view ourselves a little bit as a startup studio or license to strategic partners to go to product. So we don't do product, but we build prototypes and do all the hard work of de-risking. I'll talk a little more later.
Thank you. Jose Millan, nice to meet you. I have been working in the field of BCI for quite a few years now. I am mainly non-invasive, and I want to emphasize that many of the issues that have been mentioned in the previous session have been part of the non-invasive approach since the very early days. So maybe it is not only the different stakeholders, it is also the different BCI approaches that need to learn to talk more closely to each other. My focus is on people when I am developing the BCI technology. When I say on people, I am not simply saying I want to help people. I am saying that despite all the promises of AI alone will never make a BCI, a neurotech work. Because if we take the concept of a BCI, BCI is about people learning how to modulate volitionally their brain signals in order to convey commands that they cannot execute by themselves to a machine. And so my focus is how can machine learning, AI support such a learning? And I will mention more about that.
Thank you. That's a really insightful point about the invasive non-invasive. Okay, so I'm Karen Rommelfanger. I'm a neurotech ethicist and strategist. And since we're friends here, I'll share with you that I'm a recovering academic. So I've created many of these recommendations that were ended up being kind of doorstops and paperweights that weren't implementable. So I left that career to be more action oriented. Not to say other people can't be in those spaces, but that's what I needed to do. So I run a think and do tank. It's the first one dedicated wholly to neuroscience and ethics. And we work on creating empowered and trusted neuroscience for all by working with builders as tech developers, decision makers as policymakers, and end users and those with lived experiences. So all the people who tend to be missing. I also run a boutique consultancy where I work with think tanks and also companies to help them develop neuroethics strategies.
Hi everyone, I'm Sarah Berger. I am a senior research scientist at IBM. I have backgrounds in neuroscience, neurotechnology, bioethics, and I'm also an AI practitioner. And at IBM, I'm on the responsible inclusive tech research lab. And we basically try to develop framework methods and tools, multimodal, that help our colleagues, research practitioners, developers, I mean, you name it, even consultants, think more proactively, more responsibly, more holistically about the technologies they develop and sell. And we're a part of a multidisciplinary team. So in addition to technologists, I work with tech historians, philosophers, HDI folks, and so on and so forth.
Thank you very much. Maybe let's take on the last aspect of the involvement of multiple stakeholders, being people with this experience, being companies in, say, not only policy, but also standardization and other mechanisms for tech translation and producing impact. We had in the EU the Responsible Research and Innovation Framework that you need to involve stakeholders, but when you write your proposal to get the funding, you don't get money for it. So what can be mechanisms that can effectively improve stakeholder involvement in the development of technology and tech policy?
This is a really tough problem. Actually, we were just in Brussels last week working with another think tank to work on participatory governance, and that was a lot about how do we avoid something called engagement washing. The EU is a place actually where we have a lot of hope because they have this framework of responsible innovation, which calls for as part of its methodology, engagement with. That said, if you can do fabulous engagement work, and there's a lot of clear like science behind it and how to do it, but if you don't actually use that information, then it doesn't make it. So there was a great report funded out of Brussels in 2006, a meeting mine, so I was talking about some of you, that where actually they spoke with citizen populations who then gave 37 recommendations of what could be done, including some of the things that are being addressed by the UNESCO report now and others. So there's a lot of wisdom in communities. They're not just saying like, we're worried about mind reading. They're talking about discrimination related to technology that's making certain kinds of inferences. They're talking about equity and access. The difference is back then they were talking more about fMRI, and now we're talking about other types of things. So what we've been asking for is actually trying to go up into the chain of once you get a policy recommendation, who you have to hand it to. Once you have this engagement information, who's the touch point. So honestly, what our strategy is now is one-on-one. It's going and finding out. I mean, people, politicians, those people change every so often. You've got to build those relationships and enforce that that information is available, make it easily available, and it has to be in the form that they need. So we have a lot of tools, we're just not delivering it right. So that's one step.
There's others, but I'll pass it on.
Any other idea on how can we, for instance, in the research areas?
Well, I think at least in all the projects I have been participating in, is that we were recruiting early on in the project our potential end users, and we were involved in them since day one in the design. And we changed quite a few things along the way because we were taking their inputs and saying, just to give you a stupid example, if rather than painting this white, why you don't paint it black? Because this is too bright for me, because I have visual problems. Very stupid things that you never realize until you don't have their direct input, and you need to build trust. And this only happens when they come regularly to your lab.
Stakeholders, I think that earlier somebody in the panels and the other panels said that funding is how to access funding in the community that provides sort of the financial ecosystem to support this. I think we have to, and I don't know who it was. I think the only thing that has an impact is really product, right? And that is essentially an economic, a commercial activity. And so from that perspective, we are highly focused on how can we build networks of funding venues. And here in Europe, I think we are at a distinct disadvantage. And I think we do need, in comparison to our US colleagues, have a concerned and a concentrated effort to bring the VC, the private equity, pension fund, whoever, is actually providing funding at scale for companies that have good things going and that have survived and are looking to scale and often actually have to vote with their feet and go to the US because the funding to scale is not available. And I think here, from the perspective of having an impact for patients, and that's what motivates us, human impact, through products in the market, that requires exactly that long distance run, scaling, and so on. We need to have a conversation with the financial community, particularly here in Europe. I think in the US it's moving at a different level, but that would be community to engage very actively.
And in your perspective, what are the incentives that these funding sources have now to engage in this long game?
Well, I think from a regulatory perspective, from a perspective of access to patients through large, powerful, established academic health systems and so on, that are also much more economically motivated than in Europe, the large health systems that are typically public or entities. I think companies find it much easier to go to the US. There's the money, the regulatory path, it's quicker, and so on. So I think getting back to Europe, I think we need to really also see how can our large centers where clinical development can happen, because a lot of patients are there, and many of the conditions that we are looking at now are actually rare diseases. I know Gernot earlier talked about, we're talking about ALS, we're talking about few individuals at a large center at best, right? So we need to engage those, and we need to find a way to reduce the regulatory burden in the EU. I think initiatives in the EU that are valid intention from a policy perspective, but are not always the best guidance for us. I'm talking about the AI Act and other things that makes it even more difficult than it is already. GDPR was an earlier activity many years ago. I think we have a line of EU regulations that make life not easier compared to our competitors or colleagues in the US.
And maybe if we take on this, because AI Act from a European perspective, is depending on which sector you are, feels like this black clouds coming in, like looming in when people are afraid, what others see as this shine of hope in terms of protection. And personally, I see neurotechnology at a kind of similar position where AI was some years ago with this emerging development of governance mechanisms and regulations that are specific to this technology. So and maybe we can start with some that you have been looking at this. So what lessons can we draw from the experience of developing AI governance that can be taken for developing neurotech, both in those that we can adopt and those that we should not adopt at all?
So I think the first thing I would say is that it takes, well, actually, I'll start with a caveat. It really depends on what kind, like how your company works, right? IBM is a behemoth, right? We're huge. So we have to go through so many different processes in order to even be able to function. And so, like, as we have this conversation, I keep going, okay, well, it depends on the company size. It depends on the company model. Are you a business to consumer? And many of the things we've talked about are B2C, right? They are, whether it's in the form of research as the consumer, medical device, the patients, direct to consumer. Whereas with IBM, we are B2B. So I'm not producing BCIs, but I am supporting companies that produce BCIs. I work with neurodata. All of these things, and that changes our roles and such. So that's one thing. But I think too, I'm very much a proponent of systems thinking. So when we talk about lessons learned, it's kind of like, how do you not just scale some of these things, but how do you embed each component in the life cycle of these technologies and the system, not just the technical life cycle, but the system? How do you start equipping practitioners and technologists and ethicists and whoever it is at each stage to be able to think about these issues proactively, to mitigate them if they see something wrong? And I think that in addition to like having training and having both top down and bottom up responses, you also need to be thinking about how do you foster a culture where it's not just okay to fail, but be able to go, something is wrong here. Like, can I go to somebody without fear of, something bad happening to me? Who do I go to? What can I do right now? So actually putting like tools in place and fostering that culture, I think, is super important. There's plenty of other things, but.
If anyone wants to add to that, how they see the relation between AI, technical development and regulation, and how it will impact their places. Are we inheriting these concerns of fairness, privacy from AI that make our life more difficult?
If I can add a little bit. Rather than thinking of it as inheriting, I wonder if we can think of it as like places where it intersects or transforms or exacerbates, So like, a few people have brought this up already, but I think about how we already know, right? There's tons of studies that show that machine learning and AI has a bias problem. We can learn that. But that's just like on the data side and the data collection and representativeness of data and so on and so forth. But when we start adding, cool technology like this, which involves sensors, then we have a whole other component, a physicality component that can also introduce other sorts of biases. Did you test this on different head sizes, different hair styles? Does your sensor work as well with darker skin versus lighter skin? All of these things contribute to additional sources of bias in a way that interacts with the AI system that you're developing, right? So it's not that it's necessarily different, but it is exacerbated, in my opinion. It can be. Yeah.
So, with your permission, Ricardo, I will skip the regulation element of the equation. So I have a feeling when we are talking that AI will revolutionize the field of PCI. And the fear that I have is that if it is true, that I still doubt, if it is true that AI is so powerful, we will have a strong inequality. Because no matter whether you are recording through implanted electrodes or non-invasively, the bandwidth that we will have for communicating neural intent to an artificial agent will be so minimal compared to the outcome that we will get from the other side that, and then this is my fear, that we will start getting somehow very generic answers. And we all need to be aware that we humans are by nature lazy. If this answer is sufficiently okay, I take it as my answer. And little by little, I will fall into the mean answer. And we all know that the mean person doesn't exist. But if we all converge to that mean, we all become the mean. And then what about the individuality that BCIs are promising to unveil? This is my fear.
Here is a balance between the, if we think about these technologies that are driven by data. And on the one hand, we need to have enough data to cover the diversity of the world, and the International Brain Initiative was mentioned before, which basically combines these large-scale neuroscience projects across the globe, but across the globe doesn't cover half of the population. So what can we achieve with these technologies if by definition we don't have the data from all of this potential diversity and systems that are enough to identify individualities? So given how do we collect data and manage data today in segmented ways, so what can we do to really build brain-computer interfaces and neurotechnology that captures the diversity, not only geographically or ethnically, but also thinking about neurodivergence? What would be ways to tackle that?
If I may, I think that point that was raised earlier by Sarah about size and hair and skin color has directly impacted us. We are developing a BCI, implantable medical device ability. It's known in the field, has been developed at least for a long time, and it has a number of very attractive features. It is from the outset transmitting raw data, so really large data streams to the outset, and that is enabled through an optical data transmission protocol. And then after all of the 7 subsystems that have been built and been put together, say the question is, wait a minute, what does the color of the skin, how does that affect the data transfer, right? These are the things that need to be considered from the outset. Our sense is with these kind of technologies that are, we can argue about this, whether, a few 100,000 people around the world or more to benefit from the current implantable technologies to restore function, that is few or many, or from our perspective, it is rather few. And I think there it will need to be highly personalized. And we cannot develop a product that, is cutting across multiple, applications in patients. And so it will be very interesting to see how the big 5 in the US for ALS, which is the initial indication for those restorative implants, how they find price points. I would think the price points are going to be all in excess of 1 million. Now you might say genome editing for sickle cell is already over 1 million. And then how do we go from there? That's another big topic. That's why we at the least we have shifted our focus to non-invasive technologies, and we have shifted on to AI-guided neuromodulation, away, because there's now money and effort and concentration in the big BCI companies on restoration of function. So we have shifted, and there the question becomes very relevant. Diversity. How do you, when you talk about depression, OCD, about larger patient populations where you non-invasively, and I think Tim Mullen was earlier saying, personalized, non-invasive treatments at home. There were a number of statements from panelists made. We do think that's the future, and I do think AI is very powerful for that. I think AI is going to be the agent that, in the daily application of neuromodulation to affect these broader population type entities of health problems. AI is going to be the agent on the ground that can personalize based on, somebody mentioned earlier, also peripheral sensor input, a whole spectrum of input data about the state of the person, not only brain activity, that can find the right dose within the right modality for the individual. So that, I think, AI-guided neuromodulation is important that we involve from the outset the diversity of the population of patients that we want to serve in these.
Well, I totally agree with you that the AI is revolutionizing today because we can have better tools to develop our initial systems. I was making that warning because I am not hearing much about the fact that if we couple BCIs with sophisticated AI devices, this is where these big bias can happen. If it is true as an essential component inside the BCI, I fully agree with you. And then for me, the main question is, again, how this AI will support the individual process of the subject learning. In the case of the modulation, how the subject can close the loop, indicating, oh, this is now working for me, or no, this is not working for me. And sometimes this is not explicit, this is not, or is very subjective. We need to resort to other sources of information.
As we move towards the end of the today's session, I want to focus on what can we do now? What would be specific actions that will improve the translation policy development and make our life easier to deliver in our quest to deliver impact through brain-computer interfaces? What will be the levers? And we'll see later other suggestions from other panelists. But let's first hear from you. What would be the first thing that you think needs to be addressed, and how can we? Again, simple question.
Are you talking to me?
To the four of you.
Oh, I wasn't sure which, but should we go down? Okay. I have lots of ideas in this space, so where to start? I mean, I think one thing is that there is a frenzied conversation about neurotech governance right now. It's kind of getting out of control, and sometimes it's helpful, sometimes it's not. And so I think it's really important to be certainly first really considering what inclusion means versus just the diversity. Inclusion is diversity is high representation. Inclusion is actually you're like physically invited to the party. There's lots of people that are invited to the party, and the solution saying that somebody needs to come seek us out isn't really going to work. So we could do better in that space in general, and that's just a fundamental principle of collective wisdom, creating more better solutions that we wouldn't have on our own. Then there are other ones to consider as far as in the governance conversation. I think we need to be very measured in considering what. So AI is an enabler in this neurotechnology space. It's not this really separate thing. So we need to be considering what needs to be domain specific, meaning towards the technology, when it's appropriate to be thinking, maybe it's more appropriate to be context specific. So thinking about what the application is going to be and what kinds of misuses could happen in that space. And that's actually another place where thinking with communities, especially people who aren't expert technology developers or the community. Actually, I would say that companies should be in the picture because they know better than anyone where all these uses are going to go. But also you should be inviting people who would be the future users because they have an imagination of where they want this to go. They're going to be the ones who play out how society interacts with this. And the last thing I'll say is that we put a lot of unfair, in some ways it feels so unfair that being a neurotechnology developer is one of the hardest spaces to try to work in. Funding is really hard, the work is long, the brain is really hard to work with. And then on top of that, just the gravity of what you're doing calls upon a lot of spotlight. And it is frankly just a lot of responsibility to be intervening with the fundamental organ that makes you who you are. But I think there are things we can do to make it easier. And one is co-creation with those actors, because that's how we're going to get all the benefit, as Ryan was saying. And two is we've worked with a community of investors and entrepreneur matchmakers and have asked them, what do you want? And one of the things I asked for were toolkits. So we've made a lot of practical toolkits that just fit into people's day. These can be popularized and sure, they're part of a multi-layer, self-governance, hard law, soft law system, but they can do a lot of heavy lifting while we're trying to get all of this other things sorted out. So I'll share that later. I think I'll just close there.
Yeah, backward.
That's a better way.
Yeah,
because we have
I'm
to-
sorry, I will have to catch a plane in about minus 32 seconds, but I couldn't agree more. I think co-creation is very important. Having the patient's perspective or the representatives of the organizations that represent patients' perspective evolve from the outset. I think that, this is the most critical part, that we don't miss the moment. That, we in the end build something that fails to have the impact. I think that's very important. Many of the other things you mentioned, I would fully support, and I think we need the success story. We need an early win. I think to drive the conversation and open new doors, right? That in the early win will be with the other side, with some restorative approach. But I think we would like to find ways to open it up to a much broader population. Okay, with that, I thank you. Thank you for inviting me.
So I also agree with everything Karen said. And I think as I've been listening to people talk at this conference and also just listening to what Karen said, all that takes funding and resources. So for me, I go, something has to change fundamentally about how we're thinking about this and where we're putting our resources. And I know that's a very vague answer. I don't know how to do that. But my thing, great. This takes experts. Like as you were saying, there are experts in like participatory research. Like, I shouldn't, as a neuroscientist who's not trained in that, shouldn't have to like figure it out myself, right? We should be able to have mechanisms and funding and support to be able to start doing this. To be able to also like do the research, the fundamental research of embedding ethics into this. I mean, that also takes time and money as well. So I think there has to be some sort of shift within companies or organizations and such that actually show, not just say, but show that they're doing that work through these mechanisms, these changes in incentives.
So, a success story. I think that the success story, and there is already initial components of that, is in the field of therapeutics, rehabilitation. But this requires, and at the end of the day, I agree with you guys that the only way to reach this goal is through companies that take the risk to commercialize those systems. But for you to invest in therapeutical solutions, we need to have evidence. And this means that we need to go through clinical trials. So I take my hat off to companies like Neuroelectrics that are investing in running those clinical trials that are painful to run. But there is no other way if we don't have evidence that support that. And when we talk about therapeutics and rehabilitation, we are talking about large numbers. This is for me the future. And now I would like to continue the conversation on which are the technical ingredients for this to happen.
Go ahead.
Well, we need to have multidisciplinary teams, that's for sure. The BCI experts alone will not move a single grain of sand to make the beach. This is the number one. Second, we need to invest in creating new technology that supports the easy of use of our BCI concepts. And there, I see a lot of innovation in the field of invasive, but I don't see much yet in the field of non-invasive technology. And we have new materials. And Tim, you were saying that you are expecting the revolution of AI-guided materials. But this doesn't apply only to the invasive.
True.
For example, one of the uniqueness of an implanted system, it is that it is available 24 hours a day, 7 days a week, if you have the expert next to the user. Why we don't have yet permanent non-invasive systems? What does it take to have that? This is, for me, requirement number one. Requirement number two is that there is now enough evidence that long-term use of PCI induces plastic changes. And this is the basis for rehabilitation and therapeutical effects. How can we use AI and technology to support this technological process? And now we come back to the other components of the BCI, which are the neurophysiological principles of the plasticity that we want to induce in that kind of patient who suffers from psychiatric disorders rather than that other patient who suffers from motor disorders. How can we now exploit those principles to accelerate plasticity? And for me today, the best answer is neuromodulation. And the third is, at the end, we want patients to use this technology to get rid of the technology. This is the ideal case. So how can we help the patient train so that they can self-regulate the circuits by themselves? If we blindly believe that AI is the solution, patients will not be aware of what is going on. We have evidence that if you use too much machine learning, people become lazy and they not only not learn to modulate their brain signals, is that the initial capacity to modulate, they lost it because they are not engaged in the process. So these are my...
One point on the, how can we find these neurophysiological underpinnings? One of the requirements to get to that is to be able to measure these phenomena at large scale. But yet, today what we have is every lab, every company record their data here and there with a handful of subjects, and we lack tools to build up on this huge collective effort to create a common basis of knowledge to develop. So what can help us overcome these limitations? So everybody agrees data sharing is great, but at the moment we need to do it is pain in the back because it's very complicated, it's costly, you don't get funding for maintaining. So that's another of these enablers that I abuse of my position here to drop it, that can help us to reach these elements. And this goes both in research and product development.
Well, in research, we are now, thanks God, we are forced by major journals to share our data. Isn't it? So finally, someone bent our arms and we start playing the game.
But it's not entirely.
And funding agencies requires that we share not only the publication, but also the methods and the data. So we are moving in that direction, I believe. Not because we want to be, but because we are.
I think those are really great questions that you think believe need to be answered. And the data sharing piece is really important. And I think what Sarah said is really critical. If you value it, you allocate resources to it. So if we're in a space now where we're asking for certain requirements, so the problem with the journal, well, journals are a powerful lever for change because they have so much power, especially over academics or people need to validate their work, the peer review work. That's how science works. So they're a kind of gating mechanism. But what NIH did, in the US where they started requiring certain data sets, is the big complaint internally, and I say this being on the neurotechnology working group, so maybe I won't be next week, but anyway, is that they didn't properly offer resources and strategies for how to share that data. And there's another problem is that if we're creating new regulation that is going to start restricting or protecting certain kinds of brain data, then we have to understand, and I think Sarah can speak about this, the implications of what that's going to mean for data sharing. And if it makes things more difficult, then that means we also need to put into policy resources to make that more doable so that it doesn't hinder the science. So I think those are things we don't talk about. We talk about a lot of shoulds, but then we don't talk about what does it take to make that happen. And, another thing for the private sector is really driving the funding. Funding for neurotechnology is really weird. Funding for neurotechnology comes from a lot of private sector. Sometimes it comes from the same small individuals who just have a lot of money, and it really changes the direction of where the work goes. And so we need to actually be talking to those investors and what are incentives for that. So some investors actually told us, well, maybe like a checklist or something, things I can consider that I would ask companies to deploy, that I would check in, how I would evaluate, and also having an understanding of this means I need to invest in that too. And that is a part of the value proposition of de-risking work and also making it more sustainable and long lasting. So there's certain things, if we want them, we have to tie them with a lever.
The other thing I would say too, to tie it back in with data and also the exercise that you did earlier, I think maybe there's an assumption that we need consensus in all of this. That would be nice, but I don't think that's actually always possible. And I don't know, but I found that exercise with the human histogram really helpful and insightful because there was dissensus. And so how can we design more tools, more workshops, more spaces where we can actually have disagreements that are fruitful? And I say that because you said, oh, we all agree that, data sharing is good. I don't think we all agree, right? Depending on where we're coming from. Many companies, data is the new oil, right? It is like, no way I'm not sharing my proprietary data that I've collected or spent tons of money on. Certain communities, indigenous communities, it's like, no, this is my community's data. I don't want to share it. I don't want to put it in some model that I don't get any help from, right? So like, even just that notion, unless we openly talk about why we disagree and also our own barriers in that, we're not going to get very far. So as I think Anna was saying, it's hard. This is the hard work, right?
Yes. Yeah. And I hate that I have to stop because, well, there are several things that I will like to bring in that we haven't touched that enough. But as we move on things that can be done, and from what I heard, there are several aspects that have been mentioned, and here there are some of the suggestions that come from other panelists besides what we heard. We heard about different areas that require better efforts in terms of incentives and funding. And I guess we heard that if it's has value, you need to put resources on it. And this goes all across the chain. Sometimes when we think about resources, we think about just like a public funding agency, but in reality is the whole innovation ecosystem from private funding sources, public funding sources, how resources are allocated organizationally, for instance, at a university or a research group. There is a need for new methods in AI or enablers of using data, sharing data, metrics. That's it was mentioned before, the BCI roadmap. That was a work that was done with IEEE like about 3 years ago. And we found that there are not commonly agreed benchmarks to measure if a BCI works or not, or whether a BCI is better than others. We are clearly lacking metrics. And if we don't have them, we cannot basically go to the funders, go to the insurance companies, go to the end users and say, this thing works and makes your life better. And there is a need to also make this link to these funding sources, to these characteristics that we want the BCIs to have, being technologically performant, but also ethically aware and socially responsible, which is part of the regulation, but it's also part of how do we design systems that actually work. Because if it only works if I have a certain type of hair, or if I cut my hair, something I did a couple of weeks ago. Some of you who know me for a while, you know that I had dreadlocks until some time ago, which meant that I worked in EEG-based BCIs for 2 decades and was only able to control it last year. So that's that of course that doesn't impact my life in a great manner, but for other individuals that can have huge impact. And when we move towards the development of policy, the same idea of participatory approaches that we need in science, we need them in policy. And of course, you can invite certain experts for one afternoon and then check, but that's not a meaningful engagement with stakeholders. And that again needs resources, or let companies know that a federal agency or a regulatory is seeking information, or an international organization as well. And we need ways, not only the money for doing it, but people who know how to do it. And if I editorialize a little bit on some comment that I heard, I think we also need to think what are the skills that are necessary to develop or to build and grow a responsible, tech-oriented company, which is not only technical skills, but also the possibility of engaging these actors, the possibility of showing value and identifying these funding sectors and actors that will be with you in the long run. Because this is not a field like other sectors where you can get a return in 5 years. This is far longer. And if you get the investors thinking that they will get the return in the same way that you do with another, let's say, an app developer company or some simpler case, then you are in the wrong place. And you're set up in a quest that will be non-successful. So there are many aspects. It's a Tinder for companies and regulators. I guess I'm not sure if Tinder is the best model, but I think we need platforms and these tools. So we think about technical tools for instance, decoding the brain or measuring the brain. I think we need also better technical tools for implementing governance and responsible practices. With Karen, sometimes we were talking about full stack governance, thinking about aspects of how do you build solid products from a technical perspective and apply it to those processes and organizational processes that help you track if you are adhering of what you have said to do, which is building systems that are technically performant, that are fit for purpose, and then they respect human rights and they maybe promote one of the most important human rights, and it's one of the one that we probably speak less, is the human right that we all have of benefits from science and technology. Don't forget that. I think we should all that think about how can we make it real, not just at a very high level things that rest on paper. How can we operationalize that? I would love to talk with you all for way more longer than we have. And I'm very happy that you all accepted our invitation to join us this afternoon, talk about BCIs and how can we steer them for good. And this doesn't stop here. There are many initiatives that are going on. Know what are the ones that best fit to your interest and also to your current models. And I think we should all work together to create those incentives, to create these avenues for resourcing, building responsible brain computer interfaces. Thank you very much, Sumner, my co-organizer, and all.